Hello. Hi, friends. Hi, Aga, Fatima. Hi, Kunal, Danny, Yusuf, Sandeep, Harikishan, Mithun. Hi, 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 hi. Hello. Hi to everyone. Are you ready, guys? I'm ready. Are you ready? Oh, Metruji, Surya, Rahul, Vinci, Anuj, Neetu. So many. Ready? Okay. Amrita, Isha, Ram, Neeti, Creation. Okay, so you're all ready. I'm also ready. So, welcome to the QRP session for FMGE. I know you're all preparing for your Jan 2025 exam. So, I'm here to help you guys as far as possible. We'll try to finish. I would say as much as possible, we will try to finish. Okay, but it's a huge subject, so I can't guarantee that all 100% we will be taking, but I can guarantee that all important things we will try to cover as much as possible. Okay. Hi, Kashish. And exam is in Jan. So you're like reading very fast, right? And while reading, especially community medicine or PSM, you're like, what is this? It's like French and Latin, and everything is going above your head, nothing is entering inside. And finally, you're kind of fed up. Don't worry, guys, I'm here to help you. Okay, so yeah, let's go, let's go. Good evening, good evening. Okay, Mukul, that's something very happy to start with that you were waiting for the class. Hajira, hi. Revision kar liya? Oh, that's great. Okay, so I hope you all will agree with me. When you get up every day is giving you two choices. When you get up, you can either continue to sleep with your dreams. Of course, the dreams will come when you are sleeping, or you can wake up and chase them so that you can put a grab on them and the dream will be yours. Okay, you will be living that. So I think you all want to go with the second choice. Of course, many are still in the beginning stage, but better late than never, right? Okay, so let's start. And for those who, if just in case want to leave early, I will give you my WhatsApp number. This is my WhatsApp number, and you can write it down. I'll be available for your doubt clearance. And this is my Instagram page where I'll be posting all the academic updates. And community medicine is something which is getting updated almost every week. So naturally, once I finish my class, will come the next update. So I'm so sorry. I have to get it to you. I have to reach out to you through something. So I'll be posting them in my Insta. Okay. So shall we start, guys? All these new informations. I said, see, I know you have teen resources all around you where you will be able to find a lot of things, but someone sits and teach you, okay, this is the most important thing. You will be like, everything will be diluted, right? Because a lot of things are happening, especially in public health. So you will be like, do I need to study this? Do I need to study that? So I'll tell you what to study. Those things which are important for your exam, I will pick and give it to you. That is what I'm going to do in this session. Is it enough for FMG, Bharat? Okay. Anirudh. Is it lagging? Oh, ma'am, there is a lag. Why? Is there a lag? So sorry, so sorry. Is there a lag? Hi, Archana. Oh, there is a lag. How come? There is a delay between audio and video. Oh, let me just check advertisements. Advertisements. Audio. Audio video not matching. How come? Okay, let me just give me a small break so that I can just check with the team. Okay, I'll just get back to you. Gap between the audio and video. Seriously? Okay. I'm so sorry, guys. I wasn't aware of it that advertisements are popping up. I've informed the team. They'll do whatever is necessary to block these ads. I'm so sorry. This is happening for the first time. This ads coming up. Usually that never happens. Anyway, okay. Ma'am, is it enough? Yeah. See, for the time being, please sit back and listen. Okay. So let's not waste our time. सबको हिंदी नहीं आती है ना. Otherwise, I would have definitely taught you in Hindi. So English, I think everybody is comfortable with English. Okay. Okay, we'll start. Yeah. Okay. Okay. I'll stick on to it. I'll stick on to English. If you have any doubt, you can ask me. Okay, guys. Anyway, let's start. So, like I said, I'll be starting with updates. And that means those topics where you have a very serious update, which you can expect for the exam. With that topic, I'll be starting. And one topic where you have a serious update is nutrition. So, I'll be not only talking about the update, but we'll start with nutrition and health. And what do you eat? There is a lag. Is it still lagging? Oh my God. Why it wasn't? I mean, I'm so sorry. I'm clueless. I'm clueless. Big lag. It's not, some are saying it's not lagging. Voice is not matching. Should I need to restart, or if you want me to restart, I can do it. But will you be there? Okay, let me just ask. and log in. So okay, I don't have to do anything, right?
Recording in progress.
Hello, ma'am.
Yes.
Uh, Everything perfect,
Yeah.
ma'am.
You
I think we will go
everything.
live in 1 minute.
Okay. 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 I'll just tell them.
Ma'am, mostly this is a final testing. Please talk something
Okay.
again.
Okay. 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 So, I don't know what to say. You are checking, right now?
Yes, ma'am, we are checking.
Okay. 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 Students are saying. Okay. Okay. Is it okay now? Everything good?
Everything good, ma'am. We are going live.
Okay. Perfect. That's it. All okay. I went out for just 2 minutes and you have made a lot of conversation आपस में. That's nice. And definitely there will be a lag between me talking to you and it reaching you. Okay, that is a problem with every YouTube session because I'm talking in another platform. You are getting it in YouTube. So naturally there will be a lag, but there won't be any lag with my audio and video like it you were having it before. Okay, so we'll start with nutrition. Like I said, in nutrition we have an important update. I for those who missed out the initial session, I said there are lots of updates in community medicine. So I'll be mainly starting with those topics where there are some serious updates, and one among that is nutrition and health. So let's start with nutrition and health. See, guys, you know that what you eat. See, this is going to be a very, very simple chapter because this is all about what you eat and how it affects your life or your health. Okay, so what you eat can be mainly divided to one is macronutrients, one is macronutrients, and the other is second is micronutrients. I hope you will agree with me. Macronutrients means those things that you eat in macro quantities, like grams or kilograms. And micronutrients are the ones that you eat in micrograms or micro quantities. Okay, what you eat in macro are nothing but carbohydrate, fat, protein, right? And they give you what is the use of eating all these macronutrients? That will give you energy, right? So macronutrients will give you energy. Whatever I write is an MCQ. Whereas what is the use of micronutrients? Micronutrients are vitamins and minerals. And what is the use of vitamins and minerals? That will protect your health. So this is the protective food. Okay. Now, see, whatever you eat, there is a proportion. Okay. You call it as recommended daily allowance. You have some recommended daily for each and every nutrient that you eat, and recommended daily allowance is calculated using a formula, which is the next MCQ. Don't ask me what it is because when you read statistics, you will learn what it is. This is how it is calculated. You take the average and then 2 standard deviation. So that will cover the requirement of not 100% of the population, but 97.5% of the population. So recommended daily allowance is for 97.5% of the population. That is the next MCQ. Okay, guys, am I audible? I hope all good. Okay, so this is an MCQ. What is the formula for recommended daily allowance? See, average is for 50%, either not. Plus that, you are adding 2 standard deviation. So that will cover 97.5% of people's need. Rest 2.5 maybe needing more than that. Okay, so we are not worried about that. We are worried about the 97.5%. Okay, and next MCQ is regarding the Indian reference man and Indian reference woman. What do you mean by reference? Reference means it's a standard. That means if I want to know whether my weight and height or if I want to compare mine with some standard, I need to have a standard in India, right? For men, it is Indian reference man, and for women, it is Indian reference woman. Okay, and these are defined mainly based on 2 things: age, height, weight. Okay, BMI is also there along with age, height, and weight. Okay, so let's see the MCQs from who is an Indian reference man and woman. I hope it is okay if I am talking a little fast. Is it okay? Is it okay? Because we have to cover a lot. Okay. Anyway, I'll be talking a bit fast. Okay. So the age wise is the same for both males and females. It is 19 to 39. Earlier it was 19 to 29. Now it is 19 to 39. Weight, easy to remember. You know how? 65, 55, both are ending with 5. So 65, 55. Easy to remember. Okay. Height, usually they don't ask. They usually ask about age and weight only. Okay. So 65, 55 and 19 to 39. Okay. And BMI is the same, 20 point something. Okay, height usually they don't ask. If you want to know, I have given the height 177 centimeter for males and 162 centimeter for females. Okay, so you all might be feeling that I am coming in the Indian reference range. Right? Okay, as per age, okay, as per weight, okay, I'm coming within range, but please to understand that this is not the only things that you require. I have put something in the middle. Are you seeing? Huh? That person should be physically fit for active work, that you are, but on a working day, you should be employed for around, see, 8 hours in occupation that involves moderate activity. Are you guys doing it? You're simply sitting and reading, which is coming under sedentary. Okay. And while not in work, one more 8. What is it? 8 hours in bed. That you're lavishly doing, I'm sure. Maybe more than that. Then 4 to 6 hours moving around and 2 hours in walking and recreation. So these are the criteria for an Indian reference man and Indian reference woman, which you can expect as an MCQ. Okay. And for Indian reference man and woman, we have some numbers which I'm not going into the details, but please to understand that these numbers, which I'm going to show you, are important, or the most important one is adult male. For adult sedentary male, it is 2,100. Okay, this number you have to keep in your mind because the energy requirement of an adult sedentary male is known as, I'm going to write it here. That is the next MCQ. One, it's eating, right? You're eating. So it is known as one consumption unit. Did you see it? One consumption unit. Somebody is asking how much. It is the energy requirement of a Indian reference. Okay, something I'm unable to see. Yeah, now I am seeing. Okay, something went wrong here as well. Okay, so this is consumption unit. That means it is the energy requirement of one sedentary male. So based on that, you can say it is 1.2 for moderate, maybe 1.8 for heavy, like that you can compare. I hope it is clear. Okay, next MCQ is regarding the protein requirement. You might be thinking that it is 1 gram per kilogram body weight. It used to be like that, but that has also changed. The new requirement is you don't have to eat 1 gram. That much is not required. Don't eat a lot. It's only 0.8 gram per kilogram body weight. Have you seen? And the next MCQ is regarding how much is for one reference man and woman. That is easy to remember. I'm just going to write a simple number, 55 gram, 45 gram. So that way you can remember. Okay, guys? Okay. And we have something known as recommended daily allowance for certain nutrients, of which I would say only one is very important, which I'm going to highlight again. After all, in QRP, I will be telling you what is the most important thing, right? So this is the most important thing for iodine. See, for iodine, the requirement is something that you will definitely get for your exam. Okay, so for normal, it is 150 microgram, whereas in pregnancy, it will increase to 250, which is a very, very important MCQ. This you always get. Very, very important MCQ. Okay, requirement of iodine. Okay, let me tell you something. My intention is not to give you the knowledge, but I want you to learn it now. As long as you are sitting with me, I want you to learn it because it's very, very simple, guys. It's very, very simple. Okay, so these numbers, 150, 250, these numbers you keep in your mind. And 2,100 as one consumption unit, that also you have to keep in your mind. Okay, latest update, which came in 2024. Recently, this came out about, any idea? Food pyramid has changed. Yeah, our Indian food pyramid changed. When you were doing your MBBS, you might have seen a pyramid. And pyramid means the base is broad. And whatever you keep in the base are the ones which you can eat a lot. As you move up, naturally that becomes narrower and you have to reduce the amount of that you eat. And till recently, I would say till few months back, the broad base was having, you know, cereals, pulses, all those things that you eat a lot, like, your biryani and those things. But now, not anymore. What do you have in the base now? From 2024 onwards, there is a change in the base. I'm going to show you the latest one. Whatever new update which is important is there will definitely be reflected in your exam. So keep this new thing in your mind. Is it your serious versus now in the base? No, you are asked to eat a lot of, see, fruits and vegetables. Okay, it's fruits and vegetables that you are having in the base. 400 grams of vegetables and 100 grams of fruits. Every day you have to eat that. Okay, and cereals and nutri-cereals occupy the next position. Nutri-cereals means millets kind of thing. Above that, you have pulses, legumes, milk and curd. And at the topmost, what you should be eating, the minimum, which was same in the other one as well, which is nuts, seeds, fats, and oils. Okay, so this is the latest food pyramid. And this order is important. Okay, always remember this order. Fruits and vegetables, followed by cereals and nutri-cereals, followed by this one, pulses, followed by the rest. Okay, very, very important and newer update. So always keep this in your mind from today onwards. Not only for the exam, but for your health. If you want to stay healthy, keep this in your mind. See, everything is fine, but once you take the plate, this proportion will be gone. So ICMR has done a new plate, not just pyramid, because they know that if you talk about pyramid, everything will be gone after some time. So they have made a plate as well. Are you seeing? This is the new Indian plate from 2024 onwards. Even if you're not learning anything, at least you can stay with the plate. Whenever you take the plate, you have to divide them into two halves. In one half, completely fruits and vegetables. And in the next half, all the other things in small proportions you can keep. And around 300 ml of milk and curd. Altogether 300 ml of milk and curd. Is that clear? Okay. So from today, the moment you start having today's dinner, from there onwards, always keep this plate, Indian new plate in your mind. Okay. Okay. Moving further, we're going to talk about proteins. See, the quality of protein is something which is important for your exam. I'll show you some names. Remember these as the names coming under assessment of protein quality. I'm not going to read them because out of all this, you can read these names later. Out of all this, the one which is most important to assess the quality. That means we eat a lot, right? We eat a lot. We are eating a lot of protein. And if you want to know whether the protein that you're eating is a quality protein or not, you have to mainly look into net protein utilization. Okay. Now, what is net protein utilization? As the name indicates, after total protein that you are taking in the form of food, how much is utilized by the body? That is net protein, right? Net protein utilized by the body. Now, what is the use of protein? That is for building your tissue, right? So, net protein utilization simply means that out of total protein that you're taking in the form of food, how much is reaching your tissue? Okay. Next MCQ from NPU is, which is the food that has got highest NPU? Any idea? Okay, let me ask you this question. This alone I'm going to ask you. Which is the food that has got highest NPU? I just want to know whether I'm reaching you guys. Are you there? Food having highest NPU. Are you there? I'm not seeing. Or is that I'm not getting your messages? Where are you? No one joined after the restart? Say something, guys. At least one thumbs up so that I can understand that you are there. or any problem with what is happening? Are you able to hear me? All good? Or again, because it started with a glitch, so I'm worried whether the same glitch is happening again. All good? Am I audible? All good, guys? Sorry, guys. Now only I am able to. Oh, so sorry. Oh, so many messages. Actually, my YouTube got stuck. Mm, sorry. Okay, so which is the food that has got highest NPU? Egg. I'm sorry. You know what? I was under the impression that even now it's not working. Okay, you're right. Egg. Okay, so let's continue. Hereafter, I won't be talking for another. I mean, I won't be talking to you for another 5, 10 minutes. Okay, I'll be only taking the class. No, not soya bean. No, it's it's egg. Okay, so the NPU of egg is something very important for your exam. How much is the NPU of egg? Any idea? It is not 100. See, it's given as 100 in the book, but when it comes to your exam for NPU of egg is 96. This number you have to keep in your mind. Okay, very important. And there is an order. So it is the highest NPU is for egg, followed by which one? Egg ants, egg ants. Whenever I ask this in class, students say egg and bread. It's not bread. Think about something non-veg. Egg ants. What is the combination? Milk, followed by excess meat, followed by fish. This is the answer. See, many are saying soya bean, many are the it's not soya bean. What you need to remember is, guys, when you consider the protein value or the NPU, good protein is always non-veg protein, whereas veg protein they lack something. Haven't you heard about limiting amino acids? they have limiting amino acids. So don't think about when it comes to, the best protein, don't think about vegetable protein. It's non-vegetable or non-vegetarian protein. Okay, animal protein. Okay, guys, moving further. I've told you about NPU. In this, one more is important, which is protein efficiency ratio. Protein efficiency means how efficient is the protein in doing its job. And I've already told you the use of, or the job of protein is building of tissue. That is why if you are a gym person, you might be knowing that you are taking a lot of protein, especially egg, 5, 6 eggs, white, and that protein powder. So protein is something which is very important for building your tissue. So protein efficiency ratio means how efficient is protein in doing its job. That means when you eat 1 gram of protein, how much tissue is built. So ratio of gain in weight per unit protein consumed is protein efficiency ratio. So we have learned 2 MCQs. One is NPU and the other is protein efficiency ratio. And I think I don't have to tell you about this 10 essential amino acids, which I am skipping because you know it. This is a mnemonic. If you have a better mnemonic, you stay with your mnemonic. Mine is PVT, Tim, Hall. So PVT is phenylalanine, valine, threonine, tryptophan. So that becomes your Tim. Then Hall is histidine, arginine, leucine, lysine. Okay, of which 2 are semi-essential. That is the next MCQ. Which are semi-essential? Yes, this Ha is semi-essential. That means histidine and arginine are semi-essential. Okay, and coming to the next one, limiting amino acid. Haven't I told you that when you see in veg protein, mostly there will be something lacking. That is limiting amino acid. That means the amino acid which is most deficient. The amino acid which is deficient is known as limiting amino acid. And there are 3 situations that you have to keep in your mind. One is cereals. Cereals lack threonine and lysine. So you can remember this mnemonic. I know nothing works without mnemonic, so I'm all set with mnemonic. Okay, so TLC. Okay, TLC. Now what is TLC? It could be anything. Total leukocyte count or total lung capacity or tender love and care, whatever. When one WWF fan told me it is table, ladders, chairs, whatever is your TLC, keep this TLC in the mind. It only means that C doesn't have T and L, or T and L are lacking in C, threonine and lysine. Next is pulses. Cereals lack threonine and lysine. Pulses lack cysteine and methionine. And what is the mnemonic? PCM. That means P doesn't have C and M. Okay. Now what is PCM? I think that's the same for everyone. TAP PCM. That is how you write paracetamol, right? Okay. And then maize lack lysine and tryptophan. So remember MLT, medical lab technician. Okay. So these limiting amino acids you have to keep in your mind. Okay. And I have kept rice here. Can you see this picture, rice? Because there is an MCQ from rice. Of all the cereals, okay, the best cereal is considered as rice. You may say wheat, but no. For your exam, remember rice is the best protein. Or rice has the best protein because it has, when you compare with other cereals, this has more concentration of lysine. More of lysine is present in rice. So out of all the cereals, rice is considered as having the best protein. Okay, or it's superior in nutrition. Okay. Yes. And what am I trying to show you? Dal and roti. If you are from, this is for North Indians. This is for South Indians. I know everybody is here. So for North Indians, this combination, dal and roti. Whereas South Indians, it is puttu and kadala. Whatever. What am I trying to tell you? What is this? Dal chawal, huh? Dal chawal. What is it? This is the best combination. Why? Because of complementary action of protein. Okay. So what is lacking in cereal will be complemented by pulses. Okay. So this is known as complementary action of protein. Okay. A balanced meal. Yeah, you're right. You're right, Common. But the thing is, this is known as complementary action of protein. Because what is lacking in one protein will be supplemented by the other one. That is exactly why we are always eating cereals with pulses. Okay. Moving further about fats. And when it comes to fat, I hope you know that the best fatty acid is essential fatty acid. We'll be mainly talking about essential fatty acid. And essential fatty acids, you have to remember two essential fatty acids. One is omega-3 and omega-6. Okay. And what I'm showing in this picture are again the MCQs. Yes, Yadav, together to make it balanced, that is true. You're right. But this combination is known as complementary action of protein is what I'm trying to tell you. Okay. So complementary action of protein means the lack in one protein will be complemented by or supplemented by the other protein. Okay. So essential fatty acid, we have two, omega-3 and omega-6. First MCQ. I'll be writing the MCQs. Omega-3, the source is fish. And omega-6, the source is dry fruits and vegetables. Are you seeing? This is the first MCQ. Second MCQ, what is the use of omega-3? Omega-3 is for your heart. It is cardioprotective. Omega-3 is cardioprotective. It is cardioprotective. Next MCQ, what is the use of omega-6? Whatever I write is an MCQ. What is the use of omega-6? Good for your hair and skin. Okay, so this is for hair and skin. Hair and skin. Okay, moving further. What is your diagnosis? This is an image-based question which always come for the exam. What is it? This is phrinoderma. This is phrinoderma. And phrinoderma is seen in two conditions or when two things are lacking. One is in vitamin A deficiency. Okay. One is in vitamin A deficiency. And the second, vitamin A deficiency. And the second is essential fatty acid deficiency. So that is the next MCQ. You have to identify phrinoderma and you have to say in which all conditions you will see it. Now let's see few MCQs from the most favorite food items, egg and milk. Okay, so let's start with milk. 100 gram will give you around 70. Okay, guys, the energy given by 100 gram of milk as well as one egg is the same, around 67 or 70 kilocalorie. And protein content in human milk, it is 1.1, whereas in cow's milk, which is very important, 3.2 gram or around 3 gram per 100 ml. Whereas when you see the egg protein, which is best? Is it egg protein or is it good to take 100 ml of, see, if you have a protein deficiency and if you're asked to take 100 ml of milk and one egg, which one do you prefer? Go for egg because that will give you double the protein. Okay, that will give you 6 gram protein if you're taking one egg. And this protein content is again an MCQ. Okay. Next, I'm just going to show you a table. Don't worry. Don't look at those numbers. I'll tell you what is the MCQ. This is a comparison between cow's milk and human milk. Okay. Just two things are more in human milk. That is the MCQ. Which are the only two components which are more in human milk. One is lactose. Are you seeing? And the next is iron. Okay. So that is the next MCQ. Human milk has two things more compared to cow's milk, which is lactose and iron. So how to remember? Guys, listen. There is an easy way to remember. We know that mother's milk is lactose means sweet. Iron means strong, right? So we know that mother's milk is sweet and that makes you strong because it has more of lactose and iron. I hope you are getting the point. Okay. Next is about the egg. Like I said, egg is also giving, one egg is giving almost 70 kilocalorie, and it has got 6 gram protein and fat and 30 milligram of calcium and 250 milligram of cholesterol. So that also you have to keep in your mind. So the MCQ, most important MCQ is this and this. You have learned it, right? Okay. Now let's see what all are lacking in important food items. What is lacking? That is the next MCQ. We have seen what is more. Now let's see what is lacking. Nutrients absent. In milk, milk lacks vitamin C and iron. So remember this mnemonic, MCI. Don't worry, I'll give you mnemonic for, or wherever it is possible, I'll give you mnemonic. That means milk doesn't have vitamin C and iron, MCI. Okay. Then egg, vitamin C and carbohydrate. Oh, you remember, how do you write? Egg is written as EGG, right? Egg is EGG. So remember, you're not writing G as such, but G is kind of C, right? So E doesn't have C and C, vitamin C and carbohydrate. Next is fish lack carbohydrate. Then what is that thing that you eat? That is completely protein. And meat do not have calcium. These two are favorite MCQs. Which are? These two are very, very important MCQs. Milk lacks, egg lacks. Okay, moving. Moving further. What are the tests for pasteurized milk? There are 3 tests. Easy to remember. See, how do you get into government service? Do you know? For getting into government service, you need to write PSC, Public Service Commission. PSC. Okay, so remember PSC. These are the tests that you do in milk. Phosphatase test. With S, you have standard plate count, and C is coliform count. Sometimes you will get this question. I've seen this question, but not very frequent. Okay, so we are done with all the major things. Moving on to the micronutrients. Micronutrients are mainly vitamins and minerals, right? And as you all know, I don't know whether I need to teach you this because you might be knowing it already. Vitamins are mainly divided into 2. You have fat soluble and water soluble, right? Fat soluble and water soluble. Fat soluble are, if you have learned biochemistry, you know that ADEK, right? ADEK. Water soluble are B and C. Am I right? Okay. So we'll start with the first one, A. Yes, Neetu. Yes, Neetu. Anirudh. Anash. Yes, yes, guys. Keda. First time. Phoenix. First time I'm getting to hear that Keda. Okay. we all have learned as ADEK. No, someone is anyway. That's also nice. Keda. Seems like KD calling someone. Okay, so I'm going to ask you the MCQs. Guys, I just wish there was no lag. Thank you, thank you. Okay, what is the first clinical symptom? Symptom is something patient feels or the doctor sees. Patient feels. So what is it? What is the first clinical symptom in vitamin A deficiency? It is night blindness. Hannah, what's the first clinical sign that doctor, when you see a patient, this is the first thing that you see? Conjunctival xerosis. That means there'll be drying of conjunctiva. And do you know how it appears? It appears like this. I. Okay. See? I don't know whether you're able to make out how conjunctival xerosis appears. See, it's like, appearing like sand beds in receding tide. Like sand beds you will see. This is conjunctival xerosis. And this is, of course, dryness of cornea. So this is corneal cirrhosis. And finally, it will lead to liquefaction of the cornea. And what is something that you see almost at the end? What do you call it as? Keratomalacia. Okay, keratomalacia. And another frequently asked MCQ, which I'm sure you will answer even otherwise. What is it? You will definitely answer. I'm sure. Without fail, you will answer. What is it? Common insider. Correct, guys. This is bite or sport. And how do you identify this as bite or sport? I'm just showing you an enlarged picture. Uh, are you able to make out? It is said as frothy. Are you able to make out the froth? See, frothy, sometimes triangular or oval shape, lesions seen like this. Okay. And how do you treat vitamin A deficiency? That is an next MCQ. How do you treat vitamin A deficiency? It should be treated with vitamin A. It's a vitamin A deficiency, right? So you have to give how many doses? That is an next MCQ. 3 doses. Guys, listen and learn this. To treat vitamin A deficiency or bite or spores, you have to give 3 doses on 0, 1, and 14 day. Usually, it is given as 2 lakh international unit vitamin A on 2 successive days, followed by a booster dose on day 40. Okay. And next, if you want to identify an area as having public health problem with vitamin A deficiency, see, 1 or 2 cases is fine. But if you want to know whether, oh, that area has got a problem with vitamin A deficiency, there are some numbers. Don't worry, guys. I'll show you all the numbers, but only 2 are important for your exam. I'm planning to give you all the numbers to know the prevalence criteria for public health problem with vitamin A. Night blindness, if the rate of night blindness more than 1%, bite or sports is more than 0.5%. I'm just showing you all the numbers. Forget about the rest of the numbers, but keep these numbers in your mind. When you do a survey, and if you feel that, if you find that the prevalence of night blindness is more than 1%, or if bite or sports prevalence is more than 0.5%. By the way, guys, which will be more? Naturally, night blindness will be more, right? So if the prevalence has gone more than 1%, or if bite or sports, that is something which appears after a long time, right? So if the prevalence is more than 0.5%, that means that area has a big problem with vitamin A deficiency. Are you with me? And I'll show you the question which came in FMGE Jan 2024. Are you seeing? Are you seeing this question? Then you will realize that, okay, it's not simply that madam is showing this number. These numbers are important because I'm showing you the question. You're doing a survey in an area to know the vitamin A deficiency problem. What is the criteria to declare it as a major public health problem in the district? Guys, what is the answer here? I'm waiting to hear from you. What is the answer? Yes, you're right. Bite or sports, more than 0.8%. You're right. Absolutely right. Okay. And coming to vitamin A prophylaxis, I think with this we can stop vitamin A. Prophylaxis. As you all know, more than, that means at 9th month, right? At 9th month, completed 9 months, you are giving 1 lakh international unit. Somebody was asking how many spoons. Guys, in 1 spoon itself, there will be 2 rings, usually. Okay, spoons are of various types. Somebody was asking me. See, okay, since you have asked, there are spoons like this, there is an inside, one small, I should have brought that picture. It's there in the original class, but right now I don't have it. Okay. So if you're only filling the inside circle, that is 1 lakh international unit. If you're taking the whole thing, like you have, those lines in measurement, when you are taking medicine, like that, here also you'll have measurement. Okay, 1 lakh, 1 ml, 2 ml, like that. Okay. So 9 completed months, you give 1 lakh international unit. Thereafter, from 16 months onwards, that means from 1.5 years, you have to give 2 lakh each, right? Every 6th month. Still, I'm only writing MCQs till 5 years. Okay, I'm not yet done. See, when you look at this, you feel that, guys, this is very, very important. Please do listen to this. Please learn it now. See, when you look at this, you feel that if the child is less than 1 year, 1 lakh. If the child is more than 1 year, 2 lakh, right? But it's not like that. It's not just the age, but the most important thing is weight of the child. It mainly depends on the weight of the child. If the weight of the child is mentioned as, anyone, what is that? Less than, look at this, 8 kg. 8 kg. If the weight is less than 8 kg, that means irrespective of the age, you have to give only 1 lakh international unit. Okay. Am I clear? I have a question. I think I have a question. Oh, there was a question. Maybe it's coming. It's coming after some time. An 18-month-old, I do remember the question. An 18-month-old child, that was a question. Okay. I think I added it. It got somewhere. Idhar udhar ho gaya. Okay. 18-month child having 7.5 kg is coming to you. How much vitamin A will you give? On seeing this, you may see that you may feel that, oh, it's more than 1 year, so we have to give 2 lakh. No. See, only 7.5 kg. So you have to give only 1 lakh. Many made mistake here. Don't do it. Okay. Don't commit that mistake. If weight is mentioned, always see whether it is more than or less than 8 kg. Okay. I hope it is clear. Guys, are you with me? Rohit, Danny, Nikashini, everybody is there now with me? Yes. Over. Vitamin A over. Vitamin D. Not much from vitamin D. What is your diagnosis? Yeah, you will see. You will definitely say it as rickets. Rickets can be in the form of genuvalgum or then means bow or bow neck or, something like this, which is valgum, which is barum. Knock knee, which one? Yeah, bow legs. This is rickets, right? Which is barum, which is valgum. This is genuvalgum. This is genuvalgum. Now, this is genuvarum. How will you identify this as valgum? Are you seeing? Gum means they always stick together. Right? Are you understanding? So, gum means stick together like this. Whereas bow will be varum. Okay. And you know that vitamin D deficiency is manifesting not only as rickets, but also as osteomalacia. So next I'm going to show you a picture. Can you make out? This is an X-ray picture that you see in osteomalacia. These are pseudo fractures. These are pseudo fractures. What is it? Anyone? Correct, Rohit. Correct. Loser zone. You're right. This is known as loser zone. Okay. And next MCQ is, what is the richest source of vitamin A and D? Or vitamin A and D, the richest source is the same. It's a fish. Halibut fish. And what? What part? Liver oil. Halibut fish liver oil. Okay. And have you seen halibut? Okay, everybody's saying halibut fish. Okay. Have you seen halibut fish? Is it small or big? What do you think? What is your idea about the size? Is it small fish or big fish? I'm simply asking. Small. Oof. Everybody is saying small. Even in in Zoom, the message was big fish. Rest all small, medium. Medium is, a safe place. Are you seeing? Huh? It's a big fish. See, huge fish. Okay. Moving on to the next. Next is about the B and C. Okay, B and C. So we'll start with B. Okay, guys, very careful. I'm going to ask you a few questions. B means it's a B complex, right? That means there are various types of B. So let me ask you questions. I'm not going to write because we don't have that much time, but listen and learn it now. Is there a B1? Is there a B1? Yes. What is the name? Thiamine, right? The deficiency causes, that is an MCQ. Deficiency is also an MCQ. Deficiency causes beriberi and Wernicke-Korsakoff psychosis, right? Is there a B2? Yes. Name is riboflavin. Do you want me to write or can I just skip it? If you know, I can skip. Say something. Can I skip it, guys? No. No need. Okay, okay. Riches was a positivity. Me. Okay, okay, okay. I'm skipping. Okay. Or else, if you are asking, okay, I'll be just saying, okay, I will not be writing. So listen, for those who are asking me to say, B3 is niacin. Deficiency causes pellagra. What about B4? Heck yeah. No, no B4. What is B5? Is pantothenic acid. Deficiency causes burning food syndrome. B6, pyridoxine. And deficiency causes, all those peripheral neuritis and such things. B7, is there a B7? Yes, it is biotin. Deficiency causes hair fall, you know, dermatitis and such things. B8, no. B9, yes, folic acid. Deficiency causes neural tube defect in baby. B10, no. B11, no. B12, cyanocobalamin. Deficiency causes megaloblastic anemia, right? Okay, okay, okay. So I'm not wasting my time on that. Just for those who said, no, ma'am, please don't skip. I've said all that. Okay. Now let's see one by one. What is your answer? This came in 2023 December FMGE exam. I think 2024 only. I have mainly included 2024 questions. What is your answer? Yes, guys, alcoholic patient with global confusion, ataxia, ophthalmoplegia. Yes, it is. You're right. This is thiamine deficiency. This is thiamine. BBB. Correct. So we know that it causes Korsakoff psychosis as well as beriberi, right? Okay. And how it manifests, amnesia, confabulation, vision problem, all those things. And this also right? Okay. So this track, you can remember. Since you said you know about it, I'm just skipping. B2 deficiency causes riboflavinosis, which is manifested as glossitis, cheilitis, stomatitis, and such things. Very, very, very important. I will not skip this because every year, not only in FMG, in every NEET, INI, in every exam, this, I don't know, they just can't show, no exam will be there without this picture or some question related to this picture. What is it? Yeah, you're right. This is Castle's necklace, right? That necklace, hyperkeratosis that you see in the form of a necklace seen in pellagra, which is vitamin B3 deficiency, right? Vitamin B3 deficiency. And which are the 4 Ds in vitamin in pellagra? Another next MCQ. 4 Ds are dermatitis, diarrhea, dementia, and if untreated, that can even lead to death. And in your exam, you will definitely see most of the time, if not given as a picture, you will find some clue which say that this is pellagra. because they will mention about one diet, one food. They say that the people in this area were eating dash. What is it? This is Jover. Okay. Sometimes they may say, maize. They were eating maize. Or sometimes they may say corn. Sometimes Jover. Whenever you see any of this, always think that actually they are talking about pellagra. Because Jover or maize is rich in leucine. It has increased high concentration of leucine. So leucine will actually interfere with the metabolism of tryptophan to niacin. Okay, so that is how, there is vitamin B3 deficiency. And there is one medicine which can cause vitamin or pellagra, which is that medicine, INH. So both these are MCQs. Okay, if any of this is the staple food or if the patient is on INH, it can cause pellagra. Moving further, what is your answer? The child presented with dermatitis, thinning of hair, alopecia. Again, FMGE question. Mother is giving history of eating raw egg for long time to gain weight, which is a vitamin deficiency. Biotin, right? You're right. Biotin. Because we know that by consuming raw egg can cause biotin deficiency. You know about avidin and all, right? So you know it. And the deficiency, I said biotin is good for skin and hair. So naturally, that will lead to alopecia, then thinning of skin and such things. What is your diagnosis? Quick, quick. Correct. Madiha, right. Evident. Evident. Purnima, all of you are right. Yes, Gautam. This is vitamin C deficiency. May I know why? Why did you say this is? You're right. This is scurvy or vitamin C deficiency. Because bleeding of gum, not just that, wobbling of teeth. Teeth will be wobbling, brittle nails. Okay. And can you make out something? Can you see this? Guys, are you seeing this? This is, the hair follicles will look something like this. This is corkscrew appearance. All these are seen in scurvy or vitamin C deficiency, right? And in vitamin D deficiency, always you will get a question. In question, you will find one point. Apart from all this, another very important point they will say or mention is there is delayed what? Delayed wound healing. Is it not? They always say this, delayed wound healing. Sometimes the question will be like, delayed wound healing is seen in which of the following in which of the following deficiency. So the answer will be vitamin C. Because you know that collagen, for hydroxylation of collagen, this is important. So again, delayed wound healing is another manifestation that you see in vitamin C deficiency. Next, very important question. What's the richest source of vitamin C? They will definitely ask this question. And there's a very simple answer. Yeah, guys, zinc is also there. You're right. Amla. Correct. Infinity amla. Indian gooseberry. Amla. Correct, Asif. Moving on to minerals. Of minerals, I said iodine is the most important one. And this we have already seen. Daily requirement is 150 microgram per day. And in pregnancy, it increases to 250 microgram per day. So we have already learned it. And iodization. For getting iodine, iodine is so important, right? So you just can't live without iodine. So we need iodine on a daily basis, for which we are adding it in salt. We call it as iodized salt. And there is an MCQ from iodized salt. At the production level, it should be, this is the MCQ. Let me just highlight the MCQ. 30 ppm at the production level and 15 ppm at the consumer level. That means in the factory, minimum there should be 30 ppm. And when it reaches the consumers, when it reaches my home, it will be minimum or at least 15 ppm. So I have a question. What is happening to that iodine that they are adding in factory, when it reaches, it will be only half in my place. So what is happening? It is something which undergoes sublimation. Haven't you learned sublimation? Okay. It will be evaporated. So the quantity will be less. So this number is again very important. And then, yeah, vaporized. Correct. Vaporized. And fluorine. The level of fluorine is MCQ. The correct amount is 0.5 to 0.8 milligram per liter. And this is a double-edged sword. That means if it goes less than this quantity, or if it goes more than this, both can give you disease. Less, that means less than 0.5, it can cause dental caries. That is why for children, small children, we are asking them to take the fluoride containing toothpaste, right? Because otherwise it can lead to dental caries. And if it goes above, again, depending upon the concentration, how much more it is there, we have various conditions. Again, an MCQ. So 1.5, it can cause again, there only dental molding. 3 to 6, it can cause skeletal fluorosis. Then more than 10, it is crippling fluorosis. Okay. And this is how mottling will look like. Are you seeing? First it will be white, then it will become kind of brown. Okay. And this is skeletal fluorosis. Are you seeing? Poker back. Skeletal fluorosis. Now I'll show you a question which came in last July FMGE. See, what concentration of fluoride is typically associated with crippling fluorosis? We have seen. Crippling means more than 10. We have seen it. Crippling means the patient won't be able to walk at all. It will completely cripple him. His body will become so stiff that he won't be able to move. Okay. So here the answer is yes, 10. You guys are correct. Now, you might have understood why these numbers are important. And the last part from, whenever I say la, you will be happy, from nutrition. We have seen what is good. Now let's see what is bad in nutrition. What is your diagnosis, guys? This is neurolathyrism, right? Because you see 1 stick stage, 2 stick stage, and finally crawler stage. Now let's see the MCQ. Lathyrism is caused by eating kesari dal. You know that, right? And the toxic principle, that is the next MCQ. BOA, beta oxalyl amino alanine. Due to lack of time, I'm not writing the whole name, but I'm seeing it. And prevention of lathyrism is the next MCQ. How will you prevent it? There are many ways, but after showing the whole thing, I'll show you the most important MCQ. Vitamin C prophylaxis is a frequently asked MCQ. Which among the following vitamin is given for preventing lathyrism? It is vitamin C. Okay, vitamin C. And the rest, banning of crop, those things you can even otherwise, using your logic. Any fool can find out. Okay, if you do this, definitely you can prevent lathyrism. And then you have endemic dropsy. Very, very important. Just like pellagra, another question that I always see is endemic dropsy. How is it caused? See, whenever you hear this term dropsy, listen carefully. Very important. I'm going to teach you something with a clue. See, drops, drop, booth, is caused by two things. Which are they? One is oil. Oil can cause drops. Next is water, of course. So oil and water are the MCQs that you can expect from dropsy. Okay. So it is caused by a oil. Which oil? Argemone oil, which has got the toxin, that is sanguinarine. Now, what about water? The clinical features will be in the form of water retention, like bilateral pedal edema. I have a picture. Yeah, the patient will be having bilateral pedal edema. Again, water, something to do with water, right? Bilateral pedal edema. Then diarrhea. I think you will pardon me if I don't write because that will take a long time. Diarrhea, then cardiac failure, glaucoma, all these are the manifestations. So the question, I have seen questions in different ways. they'll see the clinical, they'll give you the clinical features, and the question will be, what is your diagnosis? Okay. And the third one that you have to keep in your mind is endemic ascites. Okay. Ascites is A, right? So remember, this is the clue. It is caused by an alkaloid. It is caused by an alkaloid. The name of that alkaloid is pyrrolizidine alkaloid. And ascites naturally must be hepatotoxic. That is why the patient is having ascites. Are you with me? So I've included many MCQs in this. So let's see the next one. One more is there. Actually, two more are there for your exam. Ergotism. It is caused by claviceps purpura. It is known by a name. What is the name? It is also known as some fire. Saint Anthony's fire. Because ergotism means what is released, ergotamine is released, and the role of what ergotamine is doing, it is causing vasoconstriction. So finally the patient will be having some you know burning like sensation, and during olden days they thought that this is the curse of god, so they were taken to Saint Anthony's church. From there they got some cure. Okay, so they thought that if you go to Saint Anthony's church, then only you will get some cure, because of which it came to be known as Saint Anthony's fire. Okay, and it is affecting rye and other cereals, like you know oh sorry. Okay, and it is a field fungus, not fungus. Okay, it's a field fungus. I'll show you. See, this is a field fungus. When it is there in the field, out in the field, it casts this fungus. Okay, and can you see, can you make out ergot? These are the ergot in the form of black. Okay, this again was a question. A barley, black colored barley was found. Which among the following toxin do you suspect? It is ergotism. Okay. And how to remove is again another MCQ, which came already. Guys, seriously, all these are MCQs. I have only picked MCQs. So it is by floating in 20% saline water. That is how you remove it, ergot. And then by hand picking and air floating. That usually they don't ask. And the last is aflatoxin. Aflatoxin is by A and A, one more A and A, aspergillus, and as you can see, it is a storage fungus. This is the storage fungus. The other is field fungus. This is storage fungus. Look at this question. A woman developed edema, visual disturbances, and heart failure after consuming a food, which is the adult trend. You all guys are giving me the correct answer. I'm so happy. Not only here, just now I was scrolling through the chats. All the answers were correct. In Zoom also. Is it D? No. Okay, visual disturbance edema. So what is the answer? It is sanguinary, right? This is drop C. Haven't I told you? Visual disturbances means glaucoma, edema, heart failure. People of a community are consuming kesari dal for the last few years. Lathyrism prevention step are all except. What is the answer? DC. You know the answer. That is why I'm giving you the answer correctly. A child presented with white patches on the anterior incisors. All these are FMGE questions, which later turned into brown. Didn't I show you the picture? So it is because of fluoride, right? A child presented with dryness of eyes, which vitamin deficiency? Again, vitamin A. It's so simple. Now everything seems like, oh, it's so simple. This was the question I was searching there. I thought I haven't included it. Now you know, 7.5, 1.5 years, but 7.5 kg. So the answer is, we have already seen, it is 1 lakh international unit. Which deficiency leads to collagen defect? Yes, it is mainly ascorbic acid. A maize eater is presenting with symptoms of diarrhea dermatitis. Of course, it is niacin deficiency. See, this many questions have come recently. I have taken only recent. Recent means in 2024 mainly. All these have come in 2024. Okay, in 2023, 2024. And the last is ICDS. Okay. One more. Which fatty acid will decrease the risk of coronary artery disease? Cardioprotective. Which one? Omega-3. Is it not? Which you find in fish. And last is ICDS. Okay. This is the logo of ICDS. And in ICDS, we are giving food, right, to children. And this you have to remember, one Anganwadi, it is given through Anganwadis. And one Anganwadi is for, if you're thinking for 1,000, not anymore. Earlier it was for 1,000, one Anganwadi. Now one Anganwadi is for less number, 400 to 800. Thereafter, it's, always plus 800. Easy to remember. Just remember this 400 to 800. Thereafter, plus 800, 4 to, again, along with that, plus 800, 4, 3, like that. You just go on adding. Okay. And the next MCQ was, there will be 300 feeding days in a year. One sec. Guys, I'm here. I actually forgot to switch off my other mobile. It was ringing, so I just switched it off. That's it. It was ringing loud. Okay, so this is the next MCQ. 300 feeding days in a year, and it should meet 1/3 of the calorie and half the protein. Very, very important. This one is very, very important because they always ask that combination. So, 1/3 of the protein, half the calorie. And some say, some MCQ will be like, one half of calorie, 1/3 protein. So you should know what is it. Calorie is a huge number. You won't be able to give half the calorie, right? Whereas protein is less. So half the protein and 1/3 of calorie. Okay. Moving. So we are done with a very, very important topic, which is nutrition. Thank God. I could finish nutrition. Moving further, healthcare of the community. Healthcare of the community means here we are going to see, okay, let me just check the chats. Okay, as if. Are you with me, guys? Hmm. Okay, so many chats. Okay, so healthcare of the community, here also we have an update. So let's see all the important MCQs along with the update. When it comes to healthcare, here we are talking about primary healthcare, right? And in primary healthcare, guys, listen, you have to remember 4 principles and 8 elements. 4 principles and double 8 elements. Which are the 4 principles in primary healthcare? You can remember that using a mnemonic. I always give mnemonic. So, very simple. Primary healthcare, principle itself is care. And we are talking about primary healthcare, right? So, the mnemonic itself is care. Now, what is it? With C, community participation. With A, yep, appropriate technology. With R, intersectoral coordination. Are you able to see that R? What to do, guys? I couldn't get anything else, so I put that R. I took that R. Then with E, equitable distribution. Okay. Now let's see MCQs from each of this. Now, community participation means if you want to give, if you want to deliver the essential services to a community, naturally you should know what is there in the, what are their problems, right? So we need someone from the community. And as example for community participation, we have Asha worker. Asha is from the community, right? Anganwadi worker. These are the examples. Examples are also MCQs. Okay, Asha worker is coming under which are the following principles of primary healthcare? Appropriate technology. Appropriate technology means scientifically sound but low cost, which is, it's not any bogus technique. It's a scientifically sound technique, but something which is less expensive and very easy to use by the community. Example, I really want to ask you. Yes, guys. Yes, Mohammed Anash. Blood test. Blood test. Anything else? Yeah, VVM. I'll take that. VVM. Correct. Infinity. VVM. Anything else? I'll take that VVM. But most commonly asked MCQ is not from VVM. ORS. Then For measuring the mid-arm circumference, what do we have? Shakir tape. All these are coming under appropriate technology. Okay. Yes, yes. Then intersectoral coordination. Intersectoral coordination means, uh, health cannot function as a standalone department. We always need help from other departments, right? When COVID came, we have seen that we took help from almost everyone around, like police department. We took help from teachers, mass media. Every department has to work hand in hand. Okay. Now, what is equitable distribution? What do you mean by equitable distribution? Same for all. Is that equitable distribution means? No. So if suppose you have 100 rupee with you and you are giving 20, 20, 20, 20 each to 5 people, that is equal. Whereas equitable means not this. Equitable means, what is it, guys? More for the needy. More for the needy is what you mean by equitable. It's not equal. It is equitable. And as an example for equitable distribution, PHCs are located in urban area or rural area. PHCs are, yes, Ashley, more for the needy. PHCs are located in rural area is an example for equitable distribution because they are the ones who always need help, right? Whereas all good hospital, everything will be all hi-fi, corporate hospitals will be there in urban area. So they don't have any problem. Whereas rural area is devoid of all this. That is why government has made PHCs in rural area, which is an example for equitable distribution. Are you seeing all these are MCQs? Okay, coming under which the following principle. And next is, I said there are 8 elements. Again, I know you will be asking for a mnemonic. So I have a mnemonic. What's the mnemonic? Elements itself is the mnemonic. Okay, so there are 8 elements in primary healthcare, which are with the education. See, these are, okay, guys, I'll tell you. These are like, the services that we are giving through. The other was, principles. Primary healthcare is standing on certain pillars, or these are the principles using which you are giving services. Then, which are the services are given by elements? Okay, so services, 8 in number. Again, study with ELEMNTS with the education about the health problems, right? With L, locally endemic disease prevention. With next G, essential drugs, right? Not any hi-fi drug, but for common health problems, essential drugs. Okay. Then M, MCH and family planning, right? For mother and child, for mothers. Then E is EPI, that means extended program of immunization, that is for children. Then nutrition. Then with T, treatment of common diseases. S, safe water and sanitation. So these are the 8 elements. So the MCQ was, which of the following are the principles. So we have 4 principles, which of the following is not an element coming. So think about these 8 elements. Okay. And we know that we have 3-tier system, right? We have 3-tier system. We have PHC. Above that, you have CHC. Below that, you have subcenter. Now, I'm going to tell you the MCQs. Okay. The population catered by one PHC is 30,000. Under one PHC, I'm just going to write the MCQs. Under one PHC, on an average, how many subcenters will be there? Any idea? There will be around 6 subcenters. Okay. And next question is, then what will be the population catered by one subcenter? PHC, 30,000. Below that, 6 subcenters. So 30,000 divided by 6, 5,000 will be the population catered by one subcenter. Next is about the field workers. That is again MCQ. We have 2 types of field workers. One is health assistant and multi-purpose worker. One health assistant, one male, one female will be posted in one subcenter. So the question is, what is the population? Next MCQ is, what is the population catered by one health assistant? Sorry. Oh. What will be the population catered by one health assistant? Same as that of PHC. And in one subcenter, there will be one multi-purpose worker, one male, one female. So what will be the population catered by one multi-purpose worker or field worker? If you simply say field worker, the one who is working in field, subcenter is field worker. So what is the population catered by one multi-purpose worker? Same as that of subcenter, which is 5,000. Are you with me? Moving up, you have CHC. And the population catered by one CHC is around 80,000 to 1.2 lakh. Okay. Now, what do you have below subset? Above CHC, we have Taluk Hospital, medical colleges. All these are there, but those are never MCQs. This is the MCQ. And below, we have people from the village, like Asha worker. They are field workers, right? They are from the village. They're not actually part of the health system. It keeps on changing in various places, right? Asha workers, Anganwadi worker. Have you heard about village health guide? All these people are coming under, in the field level. Okay. Now, don't you want to know the updates? Here comes the update. Are you all there? Ground level worker. Okay, Infinity. Better to say as field level worker, not ground level worker. Yeah, grassroots. Even that is also fine. Answer this question. What is the latest name of PHC? Yes, Yadav. They are given training. Okay, answer this. What is the latest name of PHC? I'm getting B. I'm getting C. Okay, let me see what is there in Zoom. B. Okay. Till recently, that means till 2022, the name was PHC only. But in 2022, see, they changed the name to Health and Wellness Center. Health and Wellness, no, not just PHC, Health and Wellness Center in 2022. So PHCs were HWC, PHC, then subcenters were Health and Wellness Center, that means HWC subcenter. This happened in 2022. Are you seeing? In 2022, just 2 years back. Then what happened was, after 1 year, government felt that even they were not happy with this name. They thought we have to upgrade it even more. Then what they did was, in the very next year, in 2023, in November 2023, see, this is the Geo. I'm showing you the Geo. They changed the name of Health and Wellness Centers to Ayushman Arogya Mandir with the tagline, Arogyam Paramam Dhanam. That means the ultimate wealth is your health. Actually, that is true, right? Your ultimate wealth is health. And the name is Ayushman Arogya Mandir. So, this is the new name, Ayushman Arogya Mandir. Okay, so this is the new name of our PHCs. Okay, and they have also said that whenever, along with changing the name, they have clearly said that you have to include few logos showing the services given. Are you seeing? So these logos also should be there. Like this. Okay. Are you seeing? Upswasthya Kendra. So this is a subcenter and all the services should be there in the form of a logo. So this is a new name and the tagline also we have seen. Okay. And about Asha. I'm not going into the details. Only the MCQ I'm going to highlight because always students ask me, Madam, what is the age group? Okay, this is the latest age group, 25 to 45. Then another doubt they ask us, Madam, what should be the education? According to the latest guideline, she should be having education up to, are you seeing, 10th standard? Earlier it was 8, now it is 10th standard. Okay, these are the guidelines. Actually, Asha workers, I myself know Asha workers who has not even gone up to 5th standard. That is a different thing. But what I'm telling you is, officially, it is 10th. And Asha worker is for urban area or rural area? That is for rural area. accredited social health activist. She is for rural area. And nowadays we have urban slums, right? So we have realized that even urban population, they need someone like this. So for urban area, we have, just like Asha, we have anyone? Correct, Ashley. Usha. Usha. What's the full form of Usha? Urban social health activist. And the MCQ is from Usha. One Usha is for 250 to 500 population, whereas one Asha is for, that is another question that students always ask. Till today, one Asha is for, how much? One Asha is for 1,000 population. There is no doubt about it. Okay. They may change it, but till today, it is one Asha 4,000, whereas one Usha is for 1,000 to 2,500 population, because it's a slum. So naturally in slum people will be, uh, the density will be more, whereas in rural area, if one house will be here, one house will be there somewhere. So one Usha, since it's a slum, she can cater to more population, 1,000 to 2,500. So Usha will be having more population. Is it clear? And these are also new guidelines. Every new thing is a MCQ. And you believe it or not, this has already come in the last July 2024. I'll show you the question. Anyway, we see the MCQs. One urban health and wellness center is for 15,000 to 20,000. That is for sub-center. Okay. Then one urban PHC. Okay. Name is arm only, but I'm telling you, one UPHC is for 30,000 to 50,000. And one UCHC, that means urban CHC, is for every 2.5 if it is a non-metro city, and if it is a metro city where more population is there, for 5 lakh. That is CHC. Okay. Now I'll show you the MCQ which came. If you have given the last, if anybody listening to this class have given the last FMG exam, you might have seen this question, right? For a population size, for what population size is an urban primary health center typically intended for? What is the answer? It is for 50,000. Okay. And next is sustainable development goal. Again, something that our health system is talking nowadays a lot about. Sustainable development goal, I'm not going into the details, only the MCQs. See, these are some global goals which India is also committed to do, right? So this was done in the year 2015. That is the first MCQ, because MDG, you might have heard about MD, Millennium Development Goal, that ended in 2015. So from there started Sustainable Development Goal. Okay. And okay, 193 countries, forget it. They have set 17 goals, and all these goals are to be achieved by the year, very, very, very important MCQ, 2030. You know something? The MDG, which was there before SDG, was set in the year 2000. Millennium, even otherwise, millennium means 2000. Or 1,000 is millennium. So year 2000. And they set some goals, and they said in next 15 years, we will achieve that. So they set it as 2015. And in 2015, nothing much happened. So we changed the name to a new thing, which is Sustainable Development Goal. And we put 15 more extra years. So it became 2030 now. Okay. And there are 17 goals, 169 targets. Both these are MCQs. And 304 indicators, usually they don't ask. I'm going to show you all the 17 goals. Don't worry, all 17 goals are not your MCQ, but the MCQ is. Are you seeing all the 17 goals? From this, I'm going to ask you the MCQ. Only one is directly related to health. Which one? That is MCQ. Only one is directly related to health. Which one? Is it not moving? Again stuck. Oh. I think my video is again stuck. No. I'm getting. No, directly related to health. Come on. Yes, it is goal 3. Can't you see, guys? Good health. Or maybe it is so big that you are unable to see. That is the MCQ. Goal 3 is directly related to health. I just wanted to show you so that you will see and you will learn. Rather than if I simply say goal 3, who will remember goal 3? You're seeing goal 3 because that is with good health. Okay. Are you seeing? This is goal 3 and ensure healthy lives and promote well-being for all at all ages is goal 3. So goal 3 is the one that is related to health. That is the next MCQ. Directly related to health is goal 3, under which there are 13 targets. Please remember, this unlucky number. 3 and 3 is not unlucky. 3 is considered as lucky, but 13 is unlucky, right? So third and 13 you remember. And from this 13, 4 you need to remember for the exam. Okay. That means goal 3 is with good health. So that is the one that we doctors are directly dealing with. Okay. And under which there are 13 targets. And the first 4 targets are important for your exam. First target is you have to reduce, are you seeing, maternal mortality ratio to 70 per 1 lakh live births. That is the first one. So first is mother, second has to be baby. Are you understanding? So it starts with mother and baby because they are the vulnerable population. So mother, MMR, you have to reduce to 70 per 1 lakh population, 1 lakh live birth. Whereas you have to, second is with, that means target 2 is with newborns, children. So you have to reduce the death of newborn and under 5 to 25 and 12. That means neonatal mortality rate will be reduced to 12 and under 5 mortality rate double naturally. Okay, because that will be more. Or you can remember like under 5, 25, half of that neonatal mortality 12. Half means 12.5. Okay. Half. Then 3 is with communicable diseases. We have to end the epidemic of HIV/AIDS, malaria, TB, neglected tropical diseases. That is the third one. Third is communicable. So fourth has to be naturally non-communicable. Reduce by 1/3 the premature deaths due to NCDs. Are you with me? So these you have to remember. One is with mother with MMR. 2 with baby. 3 is communicable diseases. 4th is non-communicable diseases. Okay. And I'll show you the question which came in FMG July 2024. Guys, this came. What is the answer? MMR and under 5 mortality to be achieved by 2030. Nowadays, I don't know why they are very much obsessed with numbers and calculation in FMG. It's more than a screening test nowadays. Yeah, the answer is, you're right. 70 MMR and 30. Okay. We are done with 2, not 2, 3, including STG. Moving further. Okay, moving on to the diseases. Communicable disease and non-communicable disease. Are you guys there? Is it a green signal? Can I go forward? If you permit, I'll go forward. It's almost more than 1.5 hours. I know. Are you feeling, if you're feeling sleepy or if you're feeling hungry, I can understand. The time is like that. Danny, Bittu, Hafuz, Ram, Venki. Okay, everybody's giving a permission granted. Thank you. Thank you, Bharat. Green signal. Okay. Permission granted. So, okay. If you feel like skipping hereafter, I'm again giving you my WhatsApp number. Okay, so this is my WhatsApp number. Save it. And if you have any doubt, you can WhatsApp me. Okay. I'll give you a reply. And this is my Instagram ID where I will be putting updates. Okay. So let's start since it's a green signal. No skip. No skip. Okay. So guys, we'll start with TB. Just I'm planning to go a little more faster. I hope it is okay. Yeah. Yes, Ajit. I'll give you kit number 8 update. He's asking for kit number 8 update. I'll give. Okay. If you're sitting, you will get kit number 8 update. So NTP. So TB, the new name of the program is NTP, National TB Elimination and Not Eradication Program. And let's see one by one the relatively newer things. Now we have daily regimen with fixed dose combination, right? It is fixed dose combination. All HRSD combined into one single tablet. We have newer drugs. Again, MCQ. 3 newer drugs are there: bedaquiline, delamanid, and pretomanid actual, which came in 2024. Then we have a new regimen, which is known as BPAL-M regimen. I'll tell you what it is after some time. Okay, BPAL-M regimen. So please keep these names in your mind. No injectables. Earlier it was, HR is a DS. S was streptomycin, which was an injectable. Now it is elimination, right? That means we are planning to eliminate TB. So as far as possible, no injectable in first line or second line or any line. If everything fails, okay, then you think about giving injectable. That is fine. Something has to be there, no? At last, if every oral drug fails, think about injectables. We have technologies like 99 dots, Nikshay. These are not new, but important for your MCQ. Nikshay Poshan Yojana. We have new Nikshay Poshan Yojana. That means for the portion means, nutrition. For the nutritional benefit of TB patients, we are giving some amount, which is new. I hope you know that new amount. It is 1,000 rupee per month. Not just this, there are a few more updates. So we'll see that in detail after some time. Active TB case finding. Earlier, it was only passive TB case finding. That means you will simply sit in hospital, and if any patient is coming to you, you will, do the diagnosis. Now it is elimination, right? So you are going into the field searching for, do you have TB? Do you have, fever, cough, like that you are searching. Then you have intensified TB case finding. Guys, this is different. This is not active. The other is actively going search. Intensified TB case finding means you are trying to find out TB intensively in other clinical settings as well. Like, in ICTC. What is ICTC? That is where you diagnose HIV, right? So there, don't you know that in HIV patients, TB coexist, right? So in ICTC, if someone is found to have HIV, they will again be screened for TB as well. Then NCD clinics, non-communicable disease. Which non-communicable disease? Which can present like immunocompromised, like you have in HIV. Diabetes. Okay. So in diabetes patients, again, you are screening for TB. Then in post-COVID clinics, COVID is something that we have now. And in clinic after COVID, we have post-COVID clinic where, sometimes the patient will be having long COVID. There also you are screening for, you may think it is COVID, but it may be TB as well. So this is intensified TB case finding. And then you have latent TB case finding. Now, what is latent TB? As the name indicates, what do you mean by latent? Guys, latent means dormant. That means TB bacilli is there in the body, but patient is not showing any signs and symptoms. So you're trying to pick those TB bacilli, which is, simply lying dormant in the body. There is an MCQ from this, which is the specimen that you take in latent TB case finding. Specimen is, okay, let me just, sorry. Let me just write that, okay. Latent TB case finding, LTBI. The specimen taken is, I'm just going to write the MCQ. See, in all the others, we have seen it was sputum taken as the specimen, whereas here it is blood. You are taking blood. And which is a test that you do in LTBI? It is IGRA. What is IGRA? Interferon gamma release assay. Okay. And the last is, now we have new TB preventive therapy. Are you seeing? Now we have new TB preventive therapy, which is, you might have heard about INS therapy. Now, it's not INS therapy. I'm telling you the new things. We have weekly doses of INH plus, are you seeing? Rifampicin. This is new. And it is given for 12 weeks. That means weekly INH and rifampicin given for 12 weeks. That means for 3 months. For 3 months. Okay. This is also new. So this particular slide, I want you to take a photograph of this slide in your brain. Not like this. Okay. In your brain. Each of this is an MCQ and every update I have given here. Okay. Guys, Skin test is coming, but not here in pediatrics. Okay. So let's see, when will you suspect TB? Presumptive TB. Let's go step by step. When do you suspect TB in a person? Cough more than 2 weeks, right? Is that it? No. It's not just cough. All those signs and symptoms pertaining to TB, you have to suspect it. Presumptive means under the presumption. That means when you suspect. What is the criteria for suspecting? Okay, presumption means you're assuming. When you see cough more than 2 weeks, could be TB, right? Fever more than 2 weeks, suspect TB. Significant weight loss, could be TB. Hemoptysis, could be TB. You took chest x-ray, some abnormalities there, could be TB. Okay, so these are the presumptive TB criteria for suspecting TB. So a patient with so-and-so symptoms has come to you. What next? You have to do the diagnosis, right? So for diagnosis, what is the specimen that you're taking? You're taking sputum. How many sputum? 2 sputum. One is known as port sample and the other is known as early morning sputum sample. And you know the reason, right? Due to lack of time, I'm not going to those reasons. And which is the test that you do? Test is, if you're saying CB-NAT, it's not CB-NAT, but just NAT, nucleic acid amplification test. Okay, nucleic acid amplification test, because we have two types of NAT now. One is CB-NAT and the other is true NAT, which is an Indian-made NAT. I'll show you the picture. This is CB-NAT or Gene Expert. Okay, this is an American company. And it is an expensive, big machine. It is cartridge-based nucleic acid amplification test, right? So as you see in this picture, you're taking sputum in a cartridge and then you are putting that inside the machine, and in 1 hour 45 minutes, you will get the result displayed in the monitor. And this is TrueNAT. Just in case you get a image-based question from TrueNAT, this is TrueNAT. It's a small Indian, it's an Indian-made machine. And it is portable, very easy, handheld machine, which is better. Okay. And now the new algorithm for TB diagnosis say that, see, we don't have AFP. Okay, we are not doing AFP. Instead, it is mandatory that each and every patient should undergo NAT. Okay, I repeat, each and every patient should undergo NAT. It is mandatory. The treatment is started based on NAT. Okay, even if you are doing microscopy in the, honestly, nowadays, we are not doing microscopy in the centers because every patient should undergo NAT is the new policy. Because NAT has some advantage. What is it? Even if it is a less bacilli load, that will be done by NAT. But that can be done by culture as well. But you know, culture will take a long time, whereas this we can give you result in less than 2 hours. And this will also tell you whether the patient is resistant to rifampicin or not, which is very, very important. So it is mandatory that every patient should undergo NAT. Even if you do a microscopy in the periphery, before starting treatment, you have to send them for NAT because you need to know whether the patient will respond or not to rifampicin, right? Okay. Okay. New terminologies. Another MCQ. There are two new terms. Actually, three. I'll start with two. One is loss to follow-up. This is the new name for what you used to call as defaulter. Do you guys remember? Now we don't call anybody as a defaulter. Defaulter is a person who has left treatment for more than 1 month. Okay. Now we don't call them as defaulter. You call them as loss to follow-up. Now you might be wondering what is the implication. What is implication? Defaulter means you're putting the blame on the patient, right? He defaulted. Loss to follow-up means who's responsible? I am responsible. I lost my patient to follow-up. Are you understanding? Okay. Now the responsibility is always on the doctor. Then the next new name is recurrent TB. Old name was relapse. Now you don't call anybody as relapse, but recurrent TB. Both these were previous year exam questions. Which among the following is a new terminology? Which among the following is a new terminology? It is loss to follow-up and recurrent TB. And we have one more, which is XDR TB. MDR, I hope you know. What is MDR? I don't have to tell you what is MDR. MDR means a person who is resistant to INH and rifampicin is MDR, right? INH plus rifampicin. You know that, right? Yeah. Okay. INH and rifampicin is MDR. Now, what is MDR? XDR. XDR is MDR plus extra. This is extra, right? Okay. So, what is that extra? It used to be like, XDR means MDR plus one of the fluoroquinolones. Earlier, it was like, plus fluoroquinolone plus second line injectables, right? That used to be XDR. But now, do you remember I told you no more injectables? So that definition is not holding true anymore. Okay, so it is MDR plus something else. Okay, so no second line injectable. So we have taken out the second line injectable. So it has become MDR plus fluoroquinolone. That is given a new name, which is pre-XDR. Okay, so pre-XDR is RRTB or RR means rifampicin resistant TB. Why is it not coming? Yeah, MDR or RRTB. That means rifampicin resistant TB with resistant to any one fluoroquinolone is known as new terminology, not XDR, but pre-XDR. So the next MCQ is what is pre-XDR? Okay, so this is pre-XDR. This plus extra from it will move to naturally XDR. So what is XDR? This plus, if the patient is, that means if a pre-XDR patient is resistant also to any one of the additional group A drug, that becomes XDR. So that brings you to the next question. What are the additional group A drug? Don't worry. There are only two more extra drugs. Group A drug has fluoroquinolone plus bedaquiline plus linezolid. Okay, if the patient is resistant to either fluoroquinolone or that means levofloxacin or moxifloxacin, that is pre-XDR, right? So that plus bedaquiline or linezolid or both will become XDR. I hope it is clear. So RRTB or MDR-TB plus fluoroquinolone plus bedaquiline or linezolid or both will be XDR-TB. Okay, I hope it is clear. You're learning, right? You're not just simply sitting and listening. So it's MDR plus fluoroquinolone. No, MDR plus fluoroquinolone is pre-XDR only. Along with that, additional group A drug will make it XDR. Okay. Moving to test. MCQs from test. Guys, I'll be only giving the MCQs. Important tests that we do and their resistance. First and foremost is NAT. So NAT will tell you whether the patient is resistant to which one? Okay. So NAT will tell you whether the patient is resistant to rifampicin. Right? Which are the two important drugs in ATT? One is rifampicin and the other is INH, right? Don't you know that HRZD is what we are giving for first line treatment? The second most important drug is INH. Now, don't you want to know whether the patient will respond to INH as well? For that, you do the next test, which is first line probe assay. So that will tell you whether the patient is resistant to INH. Are you with me? If I say first line, there has to be a second line, right? So which is a second line? See, this will tell you whether the patient is a case of MDR or not, right? Rifampicin plus INH. What is next? Pre-XDR. Now, don't you want to know whether the patient is just MDR or pre-XDR? For that, you do the second line probe assay. So naturally, that will tell you whether the patient is resistant to fluoroquinolone. I hope you are understanding. Don't mug up at all. And so that will tell you whether the patient is a case of pre-XDR. And what next? All the rest of the anti-TB drugs, we have liquid cultured DST, which will tell you resistant to all the other drugs. Okay, so these are MCQs, especially NAT. First line probe assay, second line probe assay. Okay, and when it comes to treatment for first line, I hope you know that it is intensive phase and continuation phase. Intensive phase in the first line for drug sensitive TB, it is 2 HRSD, 2 months of HRSD. H is INH, R is rifampicin, Z is pyrazinamide, E is ethambutol. You don't want me to write, right? Okay, then Continuation phase is for 4 months, in which you are taking one out. Which one? Z is taken out, so it becomes HRE for 4 months. Okay, and or you can even remember like for easy remembering, I think you're giving her during continuation phase, so that way you can remember. And then what next? Even the first line treatment is given based on the body weight, right? So there are 5 categories, weight categories. Do you know this? There are 5 weight categories. Easy to remember, starting with 25, ending with 75. Are you seeing? Then 5 divisions. In the first, there are 10 kilos, then 15 kilos each, again 10, then more than 75. Okay, are you understanding? So I'm just telling you how many kilograms are there in one category. Okay, so 10, 15, 15, 10. That way you can remember. Okay. Now, what about the number of tablets? I said all tablets are combined into, that means all medicines are combined into one single tablet, right? Then what is the relevance of having these weight bands? The number of tablets given per day depends upon the weight band. And how to remember? That is an XMCQ. Actually, so easy. I'll show you how to remember. No rocket science, very simple. 2, 3, 4, 5, 6. Here also 2, 3, 4, 5, 6. That means a patient who's coming in the first weight band need to take how many tablets per day? 2 tablets per day. A patient who is 65 kilogram need to take 5 tablets per day. That is how it is. Okay. I hope it is clear. And nothing to worry. See, even in the tablet, it will be written, take this many pills a day. Okay, take 2 pills a day. So this is for a person who is coming in the first weight band, right? And thereafter, there is a follow-up for first-line treatment. Follow-up, sputum. Okay, sputum follow-up is done at the end of intensive phase and at the end of continuation phase. Okay, and there is a clinical follow-up done every month. That means the patient has to come and see the doctor every month. And then the doctor will see whether the patient is responding to the drug, whether he or she has any side effect and like that. And then we also have a long-term follow-up now. Just like you have in leprosy, here we have a long-term follow-up. That means even after finishing the treatment, the patient will be kept in follow-up for a long duration. For how long? 2 years. At 6th, 12th, 18th, and 24th month, you will again do the follow-up sputum. Okay, that means you will ensure that for the next 2 years, the TB is not coming back because it is elimination, right? Okay. I'm just showing you the treatment card. Can you see? I just want to show you that this is how the treatment card looks like, whether it is a pulmonary case, extra pulmonary treatment after failure, lost to follow up. Are you seeing? See, look at this. Sputum results. All those things that I've said is there. And it is even available online. Okay, which I'm not going to show you, just showing you that everything is available online. Okay. Treatment book is available as, it's not just a, what I'm showing you is just one page. It's a book, big book. And this is the latest management algorithm of TB. I'm not going into the details. If I get time, I'll come back and explain this to you. But I don't know whether I'll be able to tell you about, how to go about in TB treatment with regard to resistance as well. Anyway, that much time is not there. Just understand that if the patient is sensitive to both INH and rifampicin, you will continue first line treatment. If the patient is resistant to rifampicin, then you have to give drug resistant regimen, which is shorter MDR regimen and longer MDR regimen. Okay, so I won't be going into the details. I'll just show you. This is the drug resistant treatment regimen. Okay, so shorter is for 9 to 11 months and longer, as you can see, is for 18 to 20 months. Okay, and this is a person who was INH resistant. Okay, these are the drugs given. I don't expect a question from this for FMGE. Anyway, and the new BPAL regimen. Okay, so BPAL regimen is for 6 to 9 months. You can guess It is bedaquiline, pretomanid, and linezolid. And we have a new regimen, which is BPAL M regimen. This is the latest one. Every latest thing is an MCQ, which came in. Are you seeing, guys? This came in 2024. This came in 2024. And BPAL M is bedaquiline, pretomanid, linezolid, along with that moxifloxacin. And this is given for 6 months. That is the MCQ. Okay. This is given for 6 months. So remember BPAL M regimen. And what is new in pediatric TB? The new guideline says that the first test, I'm not going into details, only the MCQ. The first test that you do in children is chest X-ray. Are you seeing? The first test is chest X-ray. Because for children, it's difficult to get sputum all of a sudden, right? I hope you will agree with me. So we are doing chest X-ray as the first test. It's not CPNAT or anything. It is chest X-ray. That is the latest one. And in children, it's easy to give the treatment because flavored disposable tablets are there. See, happily children are taking, right? And coming to the last part in TB, some technologies. One is Nikshay. Very, very, very important. Nikshay. Guys, are you there? Okay. You're all there, right? Okay. So, Nikshay. Nothing to mug up. What do you mean by knee? Nil, right? Knee. What is Shaya? TB. So naturally, what is it? Nikshay is something to do with elimination of TB. Okay, so remember this is coming under NTEP. Okay, now what is it? This is actually a web portal where all the details about TB patients will be available. So any hospital which is treating TB patients, they are given, as you can see in this picture, they are given their health facility ID and they are supposed to enter all the details about the patient in this web portal. So they can just log in and inside, as you see here, you will see a window like this where you can enter all the details of the TB patient. What I'm showing you is just one page. There are many pages. Do you know that? There are many pages, and as you scroll down, you will see a lot of information, including the DOTS provider's name, their mobile number, the patient's mobile number, and also the patient's savings bank details. Because through Nikshay, we are giving some amount. I'll come to it. Okay. See, when I say Nikshay, there is one more name which is similar to Nikshay, which is Nishchay. Always you confuse between Nikshay and Nishchay. Seriously, guys. And whenever there is a MCQ from Nikshay, in the option, you will definitely find Nishchay. And whenever there is a question from Nishchay, you will definitely find the Nikshay as well. Now, what is Nishchay? Nothing to mug up. Nikshay, I told you. Ni Kshaya. That means no TB. Nishchay, as the name indicates, what is the word meaning of Nishchay? What is the word meaning of Nishchay? Nishchay means to confirm, right? To confirm. Confirm what? Pregnancy. Pregnancy. So this is a urine pregnancy test kit available under our RCH program. Yes. Yes, Asif. Correct. Guys, yes. Nikshay Poshan Yojana. Poshan means food. So this is for the nutritional benefit of patients. We were giving some amount, which was 500 earlier, but not anymore. It's not 500 anymore for the nutritional benefit of patient. Why nutrition is important? Don't you know that malnutrition is a serious risk factor in TB? See, majority of us also will be having TB bacilli in the body, but we are not developing the disease because we are immune and we have good nutrition. The moment you stop taking good nutritious food, the TB bacilli will be so happy, it will come out and give you disease. Okay, so beware. And that is why we are supporting the patients with food. And for supporting them with food, now the amount has increased to how much? This also is an update in 2024. Now the amount is, are you seeing? It is 1,000 rupee per month per patient for the entire duration of their treatment. Okay. And second is, I said we have few more points to remember. They have also introduced energy-dense nutritional supplements for all those patients whose BMI is less than 18.5. for the first 2 months. Along with the money, they are also providing food, energy dense food for those who are malnourished for the initial 2 months of treatment. And there's family member coverage. Are you seeing? Under Nikshay Mitra initiative of Pradhan Mantri TP Mukt Bharat. See, I'm not going to the details. Nikshay Mitra. What do you mean Mitra? Word meaning. Mitra means friend, right? So it's like, it's a group of people who are ready to help or it's an agency which is working for the welfare of TB patients. So they are giving some help for the household contacts as well. Okay. So these are the newer points that you have to keep you have to keep in your mind for the exam under the newer things. And if you have any doubt, we have a toll-free number, which is Nikshay Sampark. Sampark means word meaning of Sampark, communicate. So for communicating, this is the number. I don't think they will ask the number, but this name, Nikshay Sampark, is a helpline for TB patients. Okay. And I've shown this picture earlier. I don't know how many of you would have noticed a phone icon. Okay, so this phone icon is as part of a technology which is known as 99 dots. I'm not going into the details, just understand that 99 dots is a mobile app for ensuring drug compliance of patients. Drug compliance. That means to know whether the patients are adhering to treatment. We have this 99 dots. So every TB patient, before they start treatment, they are supposed to download this 99 dots app. And so this is a person who is coming in the first weight band. So he'll be taking 2 pills per day, right? So every day, naturally, he will open one blister having this logo or this, this mobile or this, the call sign. So when you open that, inside you will find a toll-free number. Are you seeing? A hidden toll-free number, a random toll-free number, and the patient is supposed to give a missed call from this number after taking the medicine. Okay, then it will reach the NTEP. They will listen to your call, and then they will ensure that you have taken the correct dose. And after that, you will receive a thank you from the other end. Then only you are supposed to hang the phone. Okay, so that is how they are ensuring that using some technology, they are ensuring that every patient is taking the medicine. Now, don't ask me what if the patient is simply giving a phone call without taking the medicine. I don't think that will happen. Okay, anyway, so this is the new logo of NTEP program. As you can see, this is the theme, TB Mukt Bharat. That means elimination. And our slogan is TB Harega or Desh Jeetega. And we are planning to eliminate TB from India in which year? Next MCQ. 2025. Next year. Next year, we are planning to. At the global level, it is 2030. That is SDG. Okay. SDG is set for 2030. But we Indians, we said that, we are going to, okay, let it be for the global level. But we Indians, we are so hardworking that we will eliminate TB 5 years ahead of global target. So for us, it is 2025. Okay. Okay, guys. Yes, you're all correct. And TB should go hand in hand with HIV. So let's discuss HIV as well after that. Yeah, exam year, Vinuta. You're right. Are you with me? Shall I continue? Shall I continue with HIV? Is it possible? Is a question. It's a question. Okay. Yeah. Okay. Okay. Next is HIV. Of course, this is the logo, right? Where do you do the diagnosis? ICTC, Integrated Counseling and Testing Center. That is where you do the diagnosis. And how many tests you do? You are doing 3 tests. Okay. And this is for the adult. Whereas in children, there is a very important MCQ. The diagnosis is done using a test known as dried blood spot test. Okay. As the name indicates here, as you can see in this picture, you are taking a drop of blood, you are drying it in the filter paper, and then you are doing some technology. And this can diagnose the children as early as 6 weeks of age. That is the next MCQ. Earlier we had to wait for 18 months for diagnosis in children. Now we have something known as early infant diagnosis. We call it as EID, early infant diagnosis, which can diagnose children as early as, this is the MCQ, as early as 6 weeks of age. And the technology, which is the technology, it is earlier it was DNA PCR, now it is TNA PCR. TNA means total nucleic acid, which include DNA plus RNA. So it is total nucleic acid PCR, TNA PCR. I've written only the MCQs. Okay, shall I move further? So we are done with the diagnosis in adults as well as in children. Next is about the treatment, ART guideline. At what CD4 you will start treatment? Irrespective of CD4 count. Now the program says you don't have to look into the CD4 count at all. If someone is found to be positive, straight away you start treatment. Next MCQ, which is the drug? TLD regimen. TLD regimen. Now what is TLD? Can you see? It is tenofovir, lamivudine. This is the drug. Tenofovir, lamivudine, and dolutegravir. Tenofovir 300 milligram, lamivudine 300 milligram, dolutegravir 50 milligram. Okay. And how long will you give it? It is given for lifelong. You just cannot stop treatment. You have to give it lifelong. Are you with me? Then treatment of HIV in pregnancy is also an MCQ. First MCQ, when will you start treatment? Suppose a mother is found to be, or a pregnant woman is found to be positive for HIV. When will you start the treatment? Is it at first trimester or second trimester or something like that? No trimester. Earlier it was second trimester. Now they say you have to start at the earliest. As soon as possible, you start treatment. Okay. Drugs given, same TLD. And for how long will you give? Will you stop after termination of pregnancy? No, the patient is deceased, right? So you have to give treatment for lifelong because she has virus inside her body. It will be there throughout her life. You're giving the medicines so that, the CD4 count will be more and there will not be any opportunistic infection. So you have to give it lifelong. Okay. Next, what about a baby born to an HIV positive mother? What prophylaxis will you give her or him? This is the latest regimen. Okay, guys, please listen. This is the latest one. See, this is about the ARV prophylaxis given to a baby born to HIV positive mother. See, that depends upon whether now we are dividing children into low risk infant and high risk infant. Now, who is a low risk infant? See, it is mandatory that you have to check for the viral load of the mother after 32 weeks of pregnancy. Are you getting the point? And when you check, suppose the viral load is less than 1000 copies per ml. See, if it is less than 1000 copies per ml, that means viral load is less. Such children will be branded as low risk infant. All others will be high risk infant. Are you with me? Okay, that means viral load was more or you couldn't look for the viral load. All those will come under high risk infant. And a low risk infant, you are giving just one medicine, which is syrup nevirapine. And it is given for 6 weeks. Whereas for a high risk infant, you are giving two medications, high risk, right? So it is dual prophylaxis with nevirapine and sidobudine. And how long will you give it? That depends upon whether it is a breastfed baby or a replacement fed baby. If it is a breastfed baby, it's an exclusive breastfeeding, you have to give it for 12 weeks. If it is an exclusive replacement feeding, then give it for only 6 weeks. Is that clear? Okay. Next is about treatment of HIV TB. Don't you know that all TB patients will be cross-referred, will be checked for HIV, and all HIV patients, again, based on certain signs and symptoms, will be checked for TB. So it is quite natural that a patient with HIV will also be diagnosed to have TB and vice versa. So my question is, how will you treat a person with having both HIV and TB as per HIV-TB collaboration? How will you treat them? If you see HIV-TB, How will you treat? Which one will you start first, AATT or ART? Can HIV, what is it? Metstu is asking, can HIV mother breastfeed the baby? Yes, she can breastfeed the baby because, especially in India, we are promoting breastfeeding because it has more pros than cons. Anyway, she will be given medication, right? So her viral load will be naturally less. Okay. TB first, correct, Ajit? You have to first treat TB. Why? May I know why? Because uh, when if you start the patient on ART, what will happen? The CD4 count will increase. And as the CD4 count increases, cellular immunity will come back and there will be flaring up of signs and symptoms of TB in a patient with HIV, right? So that flaring up is known as immune reconstitution or IRIS, immune reconstitution inflammatory syndrome or immune recovery syndrome. Because there will be flaring up of signs and symptoms of TB in a patient with HIV. So it is mandatory that you have to start the patient on ATT first. Are you seeing? Wait for minimum 2 weeks. So you control the signs and symptoms of TB. You make him kind of non-infectious. Then you start the patient on ART. Are you with me? Okay. So my next question is, when you are giving HIV, TB, do you need to make any modification in the treatment? Is there any modification you need to make in treatment if you're giving both ATT and ART together? There is a problem. ATT has got rifampicin, right? Are you seeing rifampicin? And ART, you are giving TLD regimen. But there is a problem. You know what? This rifampicin can reduce the bioavailability of dolutegravir. It will make its T half to half. Usually, TLD is given as one medicine, that means one tablet per day. Okay, because it will stay for 24 hours. But rifampicin will reduce the bioavailability of dolutegravir to 12 hours. So the problem is, you have to give, if a patient who is taking both ATT and ART, the modification required is with rifampicin containing regimen, you add one additional dose of dolutegravir 50 milligram after 12 hours. Is that clear? If the patient is taking TLD in the morning, then ask him to take one extra dolutegravir at night. If the patient is taking TLD at night, ask him to take one extra dolutegravir 50 mg in the morning. If the patient is taking both treatment with ART and ATT. Okay. Then about the post-exposure prophylaxis. And in post-exposure prophylaxis, I hope you know the MCQs that you can expect. Post-exposure means suppose someone got pricked from a HIV patient. What will you do? You have to give post-exposure prophylaxis, right? When will you start it? At the earliest, you have to start. Ideally, within 2 hours, you have to start, but not beyond 72 hours. Because after 72 hours, you can't guarantee that it will protect. And which is a drug? Same TLD. For how long are you giving it? Is it for lifelong? No, this is post-exposure. So it is only given for 28 days. These are the MCQs. Okay. Moving further about HIV sentinel surveillance. Okay. There is something new. I'm not saying new, which didn't come in 2024. It was relatively newer things in HIV. Sentinel surveillance. That is, you are looking for the prevalence of HIV in certain groups. And how frequently you do it? It used to be annual. Now it is biennial. Now what do you mean biennial? What is biennial? Every 2 years. Every 2 years. I'm writing every 2 years because many children think that biennial means twice in 1 year. It's not like that. Every 2 years. And what is the next new thing? Here, you're taking the blood and you're checking not only HIV anymore, but you're also looking for, anyway, you're taking blood. So along with HIV, you're also looking for the prevalence of syphilis, HPV, and HCV. And from how many groups you are taking, that is next MCQ, from 8 population groups you are taking. Now, what is the next MCQ? Of course, which are those 8 population groups that I'm going to show you. Guys, do you know that when it comes to HIV sentinel surveillance, we have groups divided as, of course, first group is high risk group. You want to know the prevalence of HIV in high risk group. We are all coming under which group? We are all coming under what? Yes, Dr. Khan, tell me. We are all coming under which group? If you are saying low risk group, we are not low risk. We are all coming under general population. Okay. In between these two, there is a new group now. You know the name of that new group? I'm going to write it here. Bridge population. Are you seeing? As the name indicates, what do you mean by bridge population? Something which is acting as a bridge between high risk and general population, because they go to the high risk group, get HIV from there, and then they transmit it to general population. So we are looking for the prevalence of HIV in these 3 groups. Now I'll show you which are those 8 groups. Are you seeing? Pregnant women are taken as proxy of general population. They are taken as a proxy of general population. Do you agree with me? They are part of us, right? And even otherwise, they are giving their blood for checking HIV, syphilis, HPV, and all those things, right? So they are taken as proxy of general population. Then we have high risk group, which include female sex workers, sex workers, male having sex with male, then injectable drug abusers and transgender. These are high risk groups. Whereas 6, 7, and 8 are not high risk group. Whenever I ask in class, high risk group, who are the high risk group? First, that comes to the first answer I get is truck drivers. Come on, guys. Truck drivers are not high risk group. They are, don't stigmatize them. They are bridge population. They are bridge population, which include not truck drivers, long distance truck drivers. Okay, long distance truck drivers. That means they'll be gone away from the family for months. Then, not male migrants, but single male migrants. And inmates at central prison. These are the bridge population. So you are looking for, these are the 8 groups. And the MCQ which came last year was, which among the following is not a high risk group? Okay. So the answers were MSM, sorry, the options were MSMs, IDUs, transgender, single male migrants. Sorry, not single male migrants, long distance truck drivers. So students were like, oh, all are high risk group. All are not high risk group. Truckers are bridge population. Okay. And last from this particular chapter, the last, yeah, almost. Something new in STD. Someone was asking me, Madam, will you be talking about that brown? Okay, I'm going to tell you about the brown. Huh? Now, what is it? Don't you know that for STD, we are giving syndromic approach, right? Syndromic approach. That is, again, given through our National AIDS Control Program. We have some pre-packed color-coded kits. Okay. And first, I'll show you the 7 most important ones. Okay. After that, I'll give you the update. What is important for your exam is not the drugs. What you need to know are the kit number, kit color, as well as the clinical condition for which it is given. Drugs, definitely, it is something constant. You should know what to give where. That is more important, right? Okay. So let's see what are the kit numbers and the colors. Kit 1 is gray, 2 green, 3 white, 4 blue, 5 red, 6 yellow, 7 black. These are the 7 drug kits. Okay. And the conditions are urethral discharge, vaginal discharge, then genital ulcer. Guys, 3 and 4 are genital ulcer, non-herpetic. 4 is for a person who is allergic to penicillin. 5 is genital ulcer, herpetic. Then lower abdominal pain, inguinal fever. Now, don't worry. I just read all these so that if you are unable to read, you can see what is there. Now, I'll give you. I'll. I can't say it as a mnemonic. Something which will help you to recollect all these colors in the correct order. Okay, which color is what? Do you have any mnemonic? Do you have any mnemonic to remember this? If you don't have any mnemonic, I'll give you something. Uh, it cannot be called as a mnemonic, something which will, correct. Okay. Grass, ground, sky, kind of. Okay. This is what I always give my students. Guys, I want you to close your eyes and think along with me to recollect all the colors. Okay, gray, green, white, blue, red, yellow, black. If you want to remember, just close your eyes. Start from the bottom of Earth. Okay, you're below the Earth. What is the color that you see there? Gray. Come little up. What do you see? Green grass. Go little more up. You see white. Right? Little more up. You see blue sky. Right? Now it is getting evening. So what is the color? Red. It is getting, it is becoming, it's going to become night. It is yellow and it has become night. So black. Okay. Did you get it? Huh? I hope it is clear. Starting from the bottom, you see gray. Come to the top of the earth. It is green. Then go little up white. Then you see blue. Then it is getting evening. Red, yellow, black. Okay. Is that clear? Say something. Did you understand? Say yes or no. Did you understand, guys? Say yes or no. Yes. Okay. If you want, okay, gorgeous girl with bangles, right? I can even give you something like that. Something I have made. Hmm? If you are unable to visualize things, see, graying girls won't buy red yellow bags. This is my own. Okay. Thank you, Bharat. Graying girls won't buy red yellow bag. Again, gray, green, white, blue, red, yellow, black. Okay. And next, red, yellow, wearing. Okay, okay. Anyway, you have your own mnemonic. I have given you two mnemonics. Whichever you can remember, keep that in your mind. Now, coming back to the clinical conditions. See, the clinical conditions you can remember using this mnemonic. UV, G3, lab. UV, G3 lab. U is urethral discharge. V is vaginal discharge. G3, that means there are three G's, right? That means 3, 4, and 5 are, okay, see, 3, 4, and 5 are G, genital ulcer, non-herpetic to a patient who is sensitive to penicillin. Then next, allergic to penicillin. Then genital ulcer herpetic. LA, lower abdominal pain. Then B is bubo. Okay, so that way you can remember. Moving further, what is new? This is a new table. You will also find one more color, which is brown. Are you seeing brown? And brown is for anorectal discharge syndrome. It is for anorectal discharge syndrome. And the drugs usually they don't ask, but anyway, I'm showing you. It is cefixime and doxycycline. Okay, just in case they are so, they are so keen to know whether you also know about the new drugs. See, these are the new drugs. Just remember A, B, C, D. Okay. A is anorectal. B is brown. C is, it has cefixime. D is doxycycline. Okay. My mnemonic, new mnemonic. Hmm? This came only two days back, I think. This new kit. Okay. Okay, guys. What is your answer? Sexually active female who's a wife of a truck driver from a low socioeconomic status is presenting to you with whitest discharge. Which one will you do? For screening of CA cervix, which is the one? It is pap smear. Okay. But in a low resource setting, usually what you do is, um, yes, it comes under STI. Yes, Ajit, pap smear. Yeah, but let me tell you one more thing. We do pap smear. Here, the answer is pap smear because that is the only one which is feasible in the option. But we also do VIA, right? Huh? And VIA is the one that is preferred in a low resource setting. Visual inspection with acetic acid. That is done in a low resource setting. If PAPS is there, yes, PAPS is a best option. But in low resource setting, usually we do VIA. Okay. If doesn't mean that we don't do PAPS. Okay. If the question is like, in a low resource setting, which is the feasible one, go for VIA. Surveillance. It is Nikshay, right? Okay, I know you will answer. A patient with anti-tubercular drug bedaquiline, so the following ECG changes will be seen. Tell me, are you with? Oh, you're still with the old one. Which is the answer? Is it A? Ashley, is it A? Ah, correct. It is C. Correct, Noopur. Asia. Correct. We know that. Did you know that? This is another point that I want to tell you. Bedaquiline can cause QT prolongation. Okay. See how many questions have come. All these came in 2024 this year. I'm giving you the latest one because all the latest ones are important. Patient with HIV, ART is taking TLD, and after a few weeks of starting, he was diagnosed with TB and was started on ART. Which of the following dose adjustment will be required? Don't you know that? Hmm. Yeah. Yeah. Yeah, Gautam. 5 C's. It is add dolutegravir. Okay. Now let's see what is new in the next one. So we are done with HIV, TB, very important ones. And we have seen all the MCQs which came recently. UIP. Guys, do you want a 5 minutes break or something? 5 minutes break? Tell me. Yes, please. Yes. Okay. Then do one thing. Just I'll be here online. Just don't take 5 minutes. Just take 3 minutes. Okay. 3 minutes short break. Yes. Okay. Everybody's saying yes. I can see that because it's been already 9:45. Don't go for food. Just take a 2 minutes break. Somebody saying I don't mind. Yeah, as if. Okay, so majority saying break. Okay, it's just a 3 minutes break. Okay, just go back and come. Have water. I'm back after having water. Even I also wanted some water, so I had it. And this is something I have seen working. If I give a 2 minutes break, then you will sit for a long time. If I'm continuously taking, I know we are all humans, right? So you will feel tired, even if it is something very important. You will feel tired. Oh, it's not yet streaming. Ah, it is. Okay, can you see me, guys? I'm back. I thought you are there and I was talking just like that. Later realized that the streaming was not there. Yeah. No, I was saying that, if I give a 2 minutes break in the middle, you will have a tendency to sit for little more longer time. If I continuously take after 2 hours, every human, they they become very tired, right? So if I give you a short break, you will sit. So I think I can go for few more. Uh, okay, I'm not taking any time here. How long will you sit? Thank you, Ajay. And I love teaching you guys. It's not teaching, I mean, discussing, right? Because I don't have to teach. You already know all these things. You are correctly answering everything. And community medicine is very, very important, right? Um, in Jan 2024, don't think that I'm exaggerating. Promise, more than 50 questions around. I counted up till 55. And later, it was like, huge number of questions came from community medicine. How long is the class? Uh-huh. So someone is getting tired. Someone is getting tired. Okay, we'll start. UIP, Universal Immunization Program. What is new in UIP? JE, something new in JE, right? So many things are in new, relatively new in UIP. I'll just show you the National Immunization Schedule, the latest one. Whatever I have highlighted in red, you can expect MCQ because these are relatively newer vaccines. Okay, so at birth, 6 weeks, I'm not going into the details. I'll just tell you the MCQ. What all are given in birth or at birth? Again, an MCQ. Okay. BCG, OPV 0 dose, hepatitis B 0 dose or birth dose. Okay. Then 6, 10, 14. You can remember like Prio, Pro, Prio. Prio, Pro, Prio. Okay. So these are the Prio means Penta, RVV, that means rotavirus vaccine. I is IPV, injectable polio vaccine. O is OPV. Next P is PCV. Priop is what you're giving. Okay. Then in ninth month and that means 1.5. Remember ninth month and then at 1.5 years you are giving MR1, JE1 and MR2, JE2. Okay. And one more thing I would like to tell you. See guys, you can always relate. I'm just going to tell you about something new about, not new, something about the relatively newer vaccine, which you can always combine. You can combine IPV and PCV because in the schedule they are kind of given similar. IPV and PCV. They're given at 6th week, no 10. 14th week. Are you seeing? 6th week, 14th week, and after that, 9th month. See? 9th month. PCV and IPV. Okay. Then you can relate MR and JE. Both are given as 2 doses, 9 to 12 months, 16 to 24 months. Okay. And there is no TT, it is TD. From 10 years onwards, it is not TT but TD. These are serious MCQs. Okay. Next, MCQ. In prior, guys, in prior, except this O. That means penta, except the O. So I'm going to show you which are the ones that I'm going to say. Except O. That means penta, RVV, IPV, and PCV. All these are given only up to. That's the next MCQ. All these. That means in Prio, Penta, RVV, IPV, and PCV, these are given only up to 1 year. This is very important because if an unimmunized child is coming after 1 year, suppose you are getting a question, a 2-year-old unimmunized child is coming to your OP, which among the following vaccines will you give? Don't give Penta, RVV, IPV, PCV because they are given only up to 1 year. So if this is there in the option, don't go for it. Instead of Penta, you give DPT. So look for the option which has DPT in it. Are you getting the point? Because instead of Penta, you will give DPT. Is that clear? Having said that, moving on to the next MCQ. Though I said you don't give it after 1 year, you don't start it after 1 year. If the child has already taken any of these vaccine, forgot to take the subsequent doses, and coming after 1 year to take the follow-up doses, you continue. I'm saying you continue after 1 year. I said don't start. Don't start. I hope it is clear. Both have come in the MCQ earlier. That means you don't start the patients, not patients, sorry. I can't call them as patients. You can't start children with any of these vaccine after 1 year. You have to give TPT. But the second scenario is they've already started taking the first two. That means 6th month, they have already taken. Forgot to take in 10th and 14th. Coming after like 18th month to take the rest of the vaccine, continue. Is that clear? Very, very important MCQs. Moving further. Okay. Next, let's see the sites. We know that all these vaccines are not given in the same site. Few are given on the right and few in the left, right? So let's see which all are given on which all sites. There is a easy way to remember. You want to hear? What is the easy way? BJP. We know that BJP party never takes left, right? But they take left in vaccination. When it comes to vaccination, BJP is taking left. So what is B? With B, BCG. With J, JE. Which P? There are two P's. So which P? This is pentavalent. Okay. Whereas in the right, you are giving, remember, MRI. Whenever you hear RI, it's RIP, right? So MRIP. Or you can even remember prime. R is right. Or you just remember prime. Prime. Okay. E is small. So with them, we have MR vaccine. I is IPV. This P is PCV. Okay. So we can see that relatively newer vaccines are given on the right side. Whereas Penta is old. So that is given on the left. Is that clear? So this is again the next MCQ, the sites. And I think I don't have to tell you how these are given, which all are given as IM, which all are given. Don't you know that PCV, Penta, all these are given as IM? Don't you know that? Huh? PCV, Penta, IM, 0.5 ml. Then IPVs, intradermal, as 0.1 ml. Okay, those things you know, right? Okay. Now let's see what is new. What is new? MR is sub-Q. Okay. Now, guys, till recently, I was I myself was teaching students that MR and JE are given as 0.5 ml, sub-Q, and both are live vaccines. But not anymore because there is a change in JE. I'm going to tell you what is new in JE. Are you listening, guys? Okay. What is new in JE? So many things are new in JE alone. First one, it is not live vaccine anymore. It is a killed vaccine given as 0.5 ml. It is not sub-Q anymore. It is given as intramuscular. Yes. And what is the next change? Before that, let me ask you one more question. Yeah, it is given in mid-thigh. That is correct. I was coming to that because I wanted to ask you another question. With that, I thought I'll come to this. Okay. What was the question I was? Yes. The question is, which all vaccines follow open vial policy? Open vial policy. Don't you know that when it comes to our national immunization schedule, it's multi-vial because many children will be coming. It's not just for one child. So it is multi-vial. And the problem is once you open the vial, sometimes every dose will not be consumed. So can you use it further or not? That is what is given by open vial policy. So the vaccines which come under open vial policy can be kept up to 28 days or 4 weeks. Vaccines which follow open vial policy, can be kept up to 4 weeks. Whereas which do not follow open vial policy should be discarded after again 4 hours. Are you with me? 4 weeks means 28 days. Is that clear? So the vaccines which follow open vial policy can be used up to 4 weeks, whereas which do not follow open vial policy can be used only up to 4 hours. So my next question is, which are the ones that do not follow open vial policy? And I used to tell my students, even in the last class, last year class, I was saying that you have to remember the journal, very famous journal, BMJ. Okay, British Medical Journal, BMJ. And I said, B is BCG, M is MR, and I said J is JE. Okay, but again, not anymore. Now we have only 2 vaccines which will not follow open vial policy, which is BCG and MR vaccine. Whereas, look at this. I'm going to add the next point. JE follow open vial policy. Okay. And the 6th point is, till recently, we have said that JE can be given up to 15 years in universal immunization program. That is also changed. It can be given only up to, that means the maximum age group to which JE is given is 2 years in the program. Are you seeing in one vaccine itself, 6 updates I am giving? Okay, 0.5 was earlier also 0.5. The rest everything is different. Okay, that means 5 changes recently happened in JE alone. Are you with me, guys? Okay, is it clear? So these are the changes in JE. The new vaccine name is Jeep that they don't ask. It is a kill vaccine. Moving further. You know about rotavirus vaccine, right? Rota is given as, it's a live vaccine and it is given as oral dose. And the recent one is, can you see? It is available as sachet of 2 ml. Earlier it was 2.5 ml. In your park textbook, they are saying you have to give 5 drops to one child. Not anymore. Now it is available as sachet. So 1 sachet is for 1 child. As you can see in this picture, you can just flip it open and then you open the right cheek of the baby and then you instill the whole dose inside. So what this 2 ml is for one baby. Are you with me? So that is how you give rotavirus vaccine. And not coming under UIP, but another vaccine which is important for your exam, from which they always ask question is HPV vaccine. Okay, HPV vaccine is for, human papillomavirus vaccine. Whenever I ask, it's for, everybody says it is for preventing CA cervix, but please do understand that it is not only for preventing CA cervix. Then why are you giving it for males? It can also prevent so many other benign conditions like, condyloma, warts, for other conditions as well. Anyway, here, the first MCQ is ideally HPV should be given first. It should be given before start of sexual activity. Before start of sexual activity. Okay. And the age group is mainly divided into 9 to 14 years and 15 to 26 years. That means it is not usually not given beyond 26 years. And 9 to 14, it is given as a 2-dose series, 0, 6 months. As a 3-dose series from 15 to 26 as 016. Okay, 016, like you give hepatitis B. Okay, and what is new? Now we have a Indian vaccine which is known as Servavac, made in India. What is available in market is Gardasil, that is US, Glaxo. It says, whereas we have a new vaccine, which is Indian vaccine, which is Servavac. It is a quadrivalent vaccine. That means it is against HPV 6, 11, 16, and 18. That is what is available in market. From US is a nonavalent vaccine, which is against 9. Gardasil 9. We call it as 9. Nonavalent vaccine. I hope you know this. This is Vaccine Vial Monitor or VVM. Vaccine Vial Monitor. And as you see in this picture, there is a blue circle inside which you will see a white square. And what is the importance of this white? This is very sensitive to temperature. Okay. And the change of the change of color owing to the exposure to the temperature will help you to know whether the vaccine inside is potent or not. Okay. So let's see what change is happening. As it gets exposed to temperature, it changes from white to a darker color, like this. So depending upon the color, we have maybe 4 stages. Okay. Stage 1, as you can guess, it is as white as possible. Stage 2, it has become darker. Look at the inside white. Okay. It has become darker, but it is less darker compared to the outside blue. What is next? Stage 3, it is as dark as the outside blue. And in stage 4, it is even more darker than the outside blue. Okay. Next MCQ is which all can be used, which all cannot be used. Which all can be used? Stage 1 and stage 2 can be used, whereas stage 3 and stage 4 should be discarded. And this picture was given in an FMGE exam, and the question was which all can be used. This was named as bottle A, bottle B, bottle C, bottle D. And the question was which all can be used. A and B can be used, right? Okay. Are you guys there? And the last is Mission Indradhanush. As you know, Indradhanush means Indran's Dhanush. Now, what is Indran's Dhanush? Is rainbow. Okay. And what is importance of rainbow? How many colors? 7 colors. And that relates to 7 vaccine preventable diseases. Because when they started, it was against 7 vaccine preventable diseases. But now, see, we started off with Mission Indradhanush 1.0, 2.0, 3.0, 4.0. And where are we standing right now? We are at Indradhanush 5.0 now. Okay. So we are with 5.0. And under 5.0, how many diseases are covered? 12 vaccine preventable diseases are covered. Okay. If you I've already shown you the, you know, the vaccines. So if you count one by one, you will find all the 12 vaccines. Okay. Shall we move to the next newer thing in this program? Which is this program? Any idea? This is this program. What's the time? Okay. Can I take for another half an hour more? Is it okay? Okay. Will you sit for 30 more minutes? Is it okay? If you're tired, please let me know. Okay. As if. Okay. So which is this program? Can you see that your hands, the hands are holding flowers. That flowers is nothing but your health. That means your health is in your hand. So which disease or which program? Lifestyle diseases or NCD. Lifestyle diseases is because of you are the ones somehow trying to get that disease, right? It is your lifestyle. So always your health is in your hand. Okay. And what is new in that? The program name is new. The earlier name was National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease. And what is the new name? NPNCD. That is National Program for Non-Communicable Diseases. And when it comes to non-communicable diseases program, the first and foremost, most important MCQ is what is STEPS approach. Okay, so let's see what is STEPS approach. First MCQ, STEPS approach is to find out the prevalence of risk factors in NCD. As the name indicates, it is done in 3 different steps. You have step 1, step 2, step 3. In step 1, you are trying to assess the prevalence of risk factors, or you are trying to assess certain risk factors by merely asking the patient. That means using verbal method. Now tell me which all risk factors of NCD you can assess by simply asking the patient. Age, then family history, diet history, physical activity, right? Then smoking habit, drinking, all these you can assess by asking the patient. In step 2, you're going one more step further. There you are doing some physical examinations to know few more other risk factors. Now tell me which all risk factors you can assess by physical examination. Height, weight, for what? Calculate BMI. Then waist hip ratio, waist circumference, blood pressure. All these are coming under physical parameters. In step 3, you're going one more step further from step 2. There, you are doing some biochemical analysis to assess few more other risk factors by taking blood or by taking urine of the patient. Which are risk factors you can assess? Blood sugar, urine sugar, fasting lipid profile, right? All these are coming under step 3. Very, very important. Whichever the following is coming under step 1, step 2, step 3. These are important MCQs. Okay. Next MCQ is regarding what is this? This is rule of half. What is the name of this? This is rule of half. Rule of halves. What you see here is it's an image-based question. This is about rule of halves, and that is about hypertension in the community. There are mainly 3 halves, and you should be knowing all the 3 halves. It says that, see, half of the hypertensives in the community know that they have hypertension, right? Now, out of those who know they have hypertension, or out of those who are diagnosed with hypertension, only half are taking treatment, right? Yeah. And out of those who are taking treatment, only half are adequately treated, right? So these are the three halves. Can you see this is the whole community? These are the hypertensive patients, of which only half are diagnosed, of which only half are taking treatment. Only out of that, only half are adequately treated. And the question which came in the last exam was, what is the smallest circle? Many questions have come. I'm just giving you the last question. The last question came from this was, what is the smallest circle representing? Smallest circle is representing adequately treated for hypertension, right? And next image-based question, and I'll show you the question as well after some time. What is this? This picture was given and there were question, what is it? This is tracking of blood pressure. Now, what is tracking of blood pressure? See, along the y-axis you have blood pressure, along the x-axis you have time. Okay, in years. Now, what do you mean by this? See, this is a child or someone who is younger, and this is as you get older. Now, tell me, what is it showing? See, if you track the blood pressure from childhood, those having low blood pressure will tend to follow the same track. Are you seeing? Whereas those who were having high blood pressure during childhood, they will have an increase in blood pressure as they become older or as they age. Okay, so the use is that you can identify the high risk population even from childhood. Okay, so this you have to remember. And see, this question came in July FMG. This FMG, this came in 2024. According to tracking of blood pressure, if the blood pressure of a population is tracked from childhood to adulthood, then which of the following is observed? Yeah, cohort and case control. If I get time, I will take. What is the answer here? Low BP child will have a low BP in adulthood, right? Yes, you're right. All of you have correctly answered. Very good. Next new thing is leprosy. Of course, you will identify this as leprosy, right? Okay, so moving further, we'll talk about leprosy as well. Leprosy, malaria, very, very important. And leprosy may we have few newer updates. Let's see what are the cardinal features of leprosy. First MCQ, what are the cardinal features? How many are there? There are 3 cardinal features in leprosy. If any one of this is present, you can call someone as having leprosy. First is at least anyone. Definite loss of sensation in a pale or reddish skin patch. Loss of sensation with a sometimes pale, sometimes reddish skin patch. Second, enlarged peripheral nerves. Third, you did a slit skin smear examination and you found microscopically you found bacilli. Mycobacterium leprae were present. If any of this is present, you can call as a leprosy patient. And don't you know that leprosy treatment is based on whether it is a case of paucibacillary or multibacillary. Okay, now let's see what is paucibacillary and multibacillary based on these cardinal symptoms. I hope you know. So I'm just going quickly. Pauci means 1 to 5 skin lesion, more than 5 multi. No or one nerve involvement is pauci, more than one nerve becomes multi. You did skin smear examination. If you find bacilli, that naturally becomes multi. That means you could find bacilli because bacilli are so much in number. So naturally that becomes multibacillary. Okay. Now coming to treatment. Guys, there is a confusion when it comes to treatment. I know there is always a confusion in leprosy because in leprosy, we have 2 regimens. One is WHO regimen and we also have NLEP regimen, that is National Leprosy Eradication Program regimen, which is our Indian guideline. WHO says that you give 3 drugs for both pauci as well as multi. Difference is that for pauci, you give it for 6 months, whereas for multi, you give it for 12 months. Whereas Indian regimen is saying something else. As per Indian regimen, you are giving 2 drugs for POSI and 3 drugs for multi. This is a currently ongoing regimen. Okay. And like I said, POSI here also is for 6 months. Here also, here it is for 12 months. Am I clear? So, if the question is, as per the current regimen, in NLAP, go for Indian regimen. If they are specifically asking WHO, then only you go for WHO regimen. Okay. Now let's see the NLAP regimen. I'm not going into the details. I have explained that in the app very nicely. So if you have time, you can go through it. Anyway, in POSI, the drugs given are rifampicin and dapsone. Whereas in multi, along with rifampicin dapsone, you are also giving clofazimine. Okay. Now, the question. Now I'll show you the NLEP regimen. Look at this. We have a red kit as well as a green kit. Can you see? This red is for POSI. 2 drugs, rifampicin and dapsone. Whereas this red kit is for, this is for, I said POSI. This is for multi. Because we have rifampicin, dapsone, as well as this one is clofazimine. Are you seeing? And the question which came in last exam was, these kits were given. Okay, they have given exactly the same kits, and this was named as kit A, this was named as kit B. Okay, and the question was, a condition was given, and as per the condition, it was a case of POSI bacillary. And the options were, for this particular case, drug A is given for 6 months, drug B is given for 6 months. Drug A is given for 12 months, drug B is given for 12 months. And majority went for WHO regimen. Thinking that, in this platform it was taught like this, in that platform it was taught like this. See guys, if you are asked about the Indian regimen, always go for Indian regimen unless it is specified WHO, because these kits are coming under NLEP. Can't you see? The green has only 2, whereas red has 3. So this is POSI. And in POSI, you have to give, in India, you have to give green. Many rotas B for 6 months. That is according to WHO. Whereas according to Indian, it is green given for 6 months. Okay. Are you with me? Guys? Are you guys there? Okay. Now, I'm going to do the next update. There is a small change, which will come in India from April 2025. Okay. First, in the categorization, there is a small change. I'm not saying there will be a small change from April 2025. This was published recently in 2024, and they said this change will be implemented from 2025 April. Now, what is it? No much change in skin lesion. It's still, 1 to 5, more than 5. Bacilli, again, if it is present, multi. No change. Where is the change? Are you seeing? The change is here. If there is at least one nerve involvement, that will be multibacillary. Got it? See, in the other one I said, no nerve involvement or one nerve involvement will be POSI. Now it is saying if at least one will be there, that becomes multibacillary. Okay, guys. Okay, so this is the newer change. And from April 2025, not only in this guide, not only in the POSI multi categorization will there be a change, there will also be a change in the drug regimen. Now, what is it? We will be following WHO regimen from April 2025. That means from April 2025 onwards, even in India, under NLEP, will be giving 3-drug regimen for both POSI and multi. Am I clear? Okay. So as of now, your exam is in Jan, right? So if you're asked about the current regimen, think about NLEP only, the, different kits. If the question is like, what is the latest update? Or from April 2025, what will be the change? Something like that, if they are asking, then you write about the newer one. That is, in India as well, it will be like you have in WHO, POSI and multi, you will be giving 3-drug regimen for 6 months and 12 months. Am I clear? Most welcome, Kitsi. After all, it's my job, man. Okay. Malaria treatment, very, very important. And as you all know, malaria is coming under which national program? NVPDCP, right? And treatment of malaria is as per, see, don't you know that in India we have 2 types of plasmodium? One is Plasmodium vivax and the other is Plasmodium falciparum, right? And the treatment should be based on whether it is a case of PF or PV. What if it's a case of PV, Plasmodium vivax? Drug of choice are chloroquine and primaquine. You sit back and learn it now because it's so very important. Okay. Chloroquine is given for 3 days as 10 mg per kg on day 1, same 10 mg per kg on day 2, and half of that. So 5 mg per kg on day 3. Whereas primaquine is given as 0.25 mg per kg for 14 days. I have a question. Why are you giving it for 14 days? There is a problem with Vivax. What is it? Relapse, right? We know that it can give relapse. So, the hypnosoids will be residing inside the liver. So to kill all the hypnosoids and to prevent relapse, we are giving primaquine for 14 days. Okay. Next is, what if it's a case of PF? Drug of choice is ACT. That is artemisinin combination therapy. And what is that artemisinin combination therapy? That means along with artemisinin, you're giving a combination with this, which is sulfadoxine pyrimethamine. Okay. And how will you give it? Guys, you have artesunate, sulfadoxine pyrimethamine. Which among this is an anti-malarial? Artesunate is the anti-malarial, right? So that is the one given instead of chloroquine, right? So, like you give chloroquine, artesunate also should be given for 3 days as 4 mg per kg. Okay. And sulfadoxine pyrimethamine is given on day 1 alone. Sulfadoxine is given as 25 mg per kg and pyrimethamine is given as 1.25 mg per kg on day 1. What about primaquine? There is no relapse, so you don't have to give it for 14 days, but just 1 dose. That too, 3 times more than what you're giving for PV. For PV, it is 0.25, right? So for PF, you have to give it as 3 times 0.75 mg. On which day? Just 1 dose. There are 3 days. Day 1, day 2, day 3. So which day will you give it? Which day? Don't give it on day 1. Don't be so enthusiastic and give it on day 1. Already we are giving a lot of drugs in day 1. So you shift to day 2. Is that clear? Okay, so this is how you treat a case of PF. Okay, that means, see, this is how PF is treated. And this is a drug artesunate, sulfadoxine pyrimethamine combination. Okay. Now there is a modification in the regimen. What is it? Guys, look at this. What am I trying to tell you? I am highlighting Northeastern states. If you don't know Northeastern states, you should be knowing ideally. It's a general knowledge question. Huh? These are the Northeastern states. The question will be like a patient coming from Arunachal Pradesh or a patient coming from Assam or Meghalaya. That will be the question. You have to understand that this is one of the Northeastern states. General knowledge. Don't expect me to teach that. Okay. So the point is, if the patient is coming from one of the Northeastern states, they have already developed resistance to artesunate sulfadoxine pyrimethamine combination. So there you have to give them something else. What is it? Artemether lumefantrine. Artemether lumefantrine. Okay. So this should be given for 3 days. Okay. That is for Northeastern states. And if it's a case of combined infection, that means PV plus PF. You have to treat for PF. That means ACT. Are you seeing? At ACT, you have to give. And the problem with PV is relapse, right? So you have to give primaquine 0.25 mg for 14 days to prevent relapse. Are you with me? And malaria in pregnancy. Very, very important. In pregnancy, one drug cannot be given. Which one? Primaquine is contraindicated. So if it is a case of PV, you give chloroquine alone. Don't give primaquine. If it is a case of PF, then in the first trimester, you can't give ACT. Instead, you give quinine. Okay. Quinine is given. And second and third trimester, you are giving ACT. Okay. And in complicated malaria, that is the next MCQ. How will you treat complicated malaria? Complicated means the patient will be mostly having cerebral malaria, right? So he or she is not in a state to take anything orally. So there, for the initial 24 to 48 hours, you have to give parenteral treatment, some IV treatment, either in the form of artemisinin derivative or quinine. After that, so that is the point. Initial 24 to 48 hours, it should be parenteral treatment. After that, once the patient starts tolerating oral treatment, then you can switch over to oral treatment. Okay. So that finishes malaria. Okay. One more thing, chemoprophylaxis. I hope you know. For less than 6 weeks, if the patient has chemoprophylaxis given for a person who is traveling to an area where malaria is endemic. So if the travel is for less than 6 weeks, you are giving doxycycline. If it is more than 6 weeks, you are giving mefloquine. Okay? Correct, correct. Why am I teaching you? You all know about everything. It's a good thing. I'm happy actually to know that. Usually I have to sit for a long time to get some answer from students. Here you are like, it's coming just like that. So prompt. Good. Happy to know that. Identify the disease in a picture. I'm only giving you repeat questions. You're running out of time. Can you see bat? Half-bitten fruit? Pig? Man. So this is Nipah, right? And in Nipah, I'm just showing you the MCQs. Pig is the amplifier host. Bat is the reservoir. Which bat? It's a fruit bat. Okay, the name of that fruit bat is, can you see? Pyropus fruit bat. It's a fruit bat. Next image-based question. Oh. Okay. I just striked off the name of the disease. Okay, which is a disease? It was there. It's a pregnant woman. She's bitten by a mosquito. Can you see? And mosquito is transmitting something which is reaching through the placenta, the fetus, and it is affecting the brain of the, it is affecting the brain of the fetus. So pregnancy, baby's brain, mosquito. It is Zika. It is Zika. Okay. Which mosquito? Aedes mosquito. And what is it causing in brain? Microcephaly. Okay. Then you have Japanese encephalitis. This is Japanese encephalitis because, again, I'm going to give you many MCQs from this. It is caused by Culex mosquito. Reservoirs are water birds. Here also you will find pig. Always pig will be there somewhere because it is acting as an amplifier host. And humans are and horses are dead end host. Okay. And guys, I have seen this as a match the following question earlier. Okay. They'll be given water birds, humans, Culex mosquito, all these on one side, and on the other side, amplifying host, then dead end host. Those will be there, and you have to match the following. Okay. Treatment of H1N1. Treatment and prophylaxis. It is H1N1. Oseltamivir, right? Oseltamivir 75 mg for treatment, BD for 5 days. For a person who is a contact, same oseltamivir, same 75 mg, same 10 tablets. Then what is the difference? It is given as once daily for 10 days. And is there a vaccine available for H1N1? They are preventive. I'm a preventive doctor. So is there a vaccine available? Yes. It will get updated every year. So you have to take yearly shots, right? You have to take yearly shots. RRR. What is it? You must be thinking about the RRR movie, the famous movie which made us so proud, right? But when it comes to public health, RRR is not good. It is telling you about 3 risk factors in a disease. Which are they? Yes, Kausalya, you're right. First R is rat. Second R is rice field. And third R is rain. Okay. So whenever you see any of this in the question, the answer will be leptospirosis. Most often, the answer will be leptospirosis. Okay. And you will also find something like this, which has already come. Okay. Here also you can see rat urine, which is the disease shown in the life cycle was the question. Again, leptospirosis. And in leptospirosis, we know prophylaxis given as doxycycline. Dose 200 milligram. What is the schedule? Weekly once. As long as the exposure is lasting, especially in flood. As long as the exposure lasts, you can give it. Or around 6 weeks. If nothing is mentioned, around 4 to 6 weeks is what we give it. Okay. New ARI guideline. I'm just checking. I'm not sure how long I'll be able to finish it. Okay. So this is the new ARI. Can I go faster? Okay. So this is the new ARI guideline. According to the new ARI guideline, we know that we have 3 categories. No pneumonia. See, the categorization is mainly based on whether chest indrawing is present or fast breathing is present. Okay. So if no chest indrawing, no fast breathing, only cough and cold, it is a case of no pneumonia. If chest indrawing or fast breathing or both are present, it is a case of pneumonia. Now, what do you mean by severe pneumonia? Severe pneumonia means along with these, if the patient is having any of the signs of severity, like are you seeing not able to drink, persistent vomiting, convulsion, lethargy, unconsciousness, stridor, severe malnutrition, if any of these is there, it will be a case of severe pneumonia. Now, what to do with no pneumonia? No pneumonia means just treat them at home. They're coming under green. This is as per IMNCI. As per IMNCI. Okay. Are you seeing? Just treat them at home. Pneumonia means it's coming as yellow. Sorry. Where is it gone? Okay. It is pneumonia means you just need to give oral antibiotic, which is amoxicillin. And general signs, any danger signs, that means you have to refer them to a higher center. Are you with me? And coming to animal bite management. Whenever there is an animal bite or dog exposure or cat exposure, what you need to do is you have to first wash under running water and soap. Okay, you have to wash under running water with soap for minimum 15 minutes. After that, you have to categorize. And we have 3 categories, right? Category 1, 2, 3. Category 1 means no exposure, as in the case of, feeding the animal or touching the animal or, licks on intact skin. If you have pet at home, definitely you all will come across category 1. No, nothing required. Category 2 means there is a slight exposure, as in the case of, nibbling of uncovered skin. Nibbling means it's not bite exactly, that gentle bite that animals give with their lips, kind of. Okay, so that is nibbling. Then minor scratch without bleeding. No bleeding, because once bleeding comes, that will go under category 3. So category 2, you give vaccination alone. You give vaccination. And under category 3, you have wounds with bleeding. Then there was a open wound and animal licked on it. Definitely there is a high exposure, right? Then lick on mucosa or exposure on mucosa. Then wild animal bite, that becomes category 3. So there, along with vaccination, you also should give immunoglobulin. Okay. Now let's see how to treat or how to prevent. It's not treating. There is no treatment. It's prevention, right? So prevention, we have post-exposure prophylaxis, pre-exposure, re-exposure prophylaxis. It's very, very, very important. Okay. So post-exposure prophylaxis, we have mainly 2 regimen. One is intramuscular regimen, and we also have intradermal regimen. Intramuscular is known as SN regimen, and it is given for 5 days as 0, 3, 7, 14, 28. Intradermal regimen is known as thigh regimen. Okay, and it is given for 4 days as 0, 3, 7, no 14, 28 days. Are you with me? Now, how to remember? There is an easy way. Guys, listen. There is an easy way to remember. Okay? Just see the number of letters you have in each name. SN, 5. So it is given for 5 days. Thigh, 4 letters. So it is given for 4 days. I'm not yet done. Pre-exposure is given for a person who is a high risk, but he didn't get any exposure so far. So for them, pre means 3 letters. So it is given for 3 days as 0, no 3, 7, no 14, 28 or 21 days. Both are correct. Next is re-exposure. Re means again. So this is for a person who is already vaccinated and now coming with one more exposure. Okay. So for them, how many letters are there in re? 2. So you are giving as 2 doses on 0 and 3 days. Are you getting the point? See, 5, 4, 3, 2. Easy to remember. Okay. And this 0 and 3 re-exposure is given only for a person who got vaccinated more than 3 months ago. That means if the last vaccination was within the last 3 months, there is no need for re-exposure. You just ask him to give reassurance, wash it and leave the patient. Okay. And this, I think, this is trachoma, right? And in trachoma, if any 2 of the following is present, I'm just showing you. I'm not going into the details. If you get time, go through all this. Okay. Any 2 of this is present, you can diagnose. And this is limbal follicles, scarring. Okay. Pannus, Herbert Spitz. And the drug of choice is azithromycin. How will you treat? Oh, drug of choices is, okay. Azithromycin. And You know about SAFE strategy, right? SAFE strategy is in trachoma. S is surgery for intern eyelid. A is antibiotic with uh, azithromycin. F is facial cleanliness because eye seeking flies will be there and environmental changes. Okay. So again, E, F, they always ask is 4 in SAFE strategy. This is very, very important. And many I want to show you, but we don't have that much time. Chickenpox, right? And the treatment given for chickenpox is acyclovir, 800 milligram, right? This is herpes zoster. You will see it along a dermatome. It will be painful, right? Along a sensory nerve, you will find it. Here also, you are giving acyclovir, 800 milligram. This is measles. And in measles, you will see something like this. What is it? This is, can you see? Koplik spot, which is seen before the rash appears. That is in XMCQ, before the rash appears. I have a better picture of Koplik spot. Are you able to make out Koplik spot now? This is seen in measles. Then you have rubella. In rubella, it is German measles. There, another thing. See, in measles, you will find 3 C's. Cough, coryza, conjunctivitis. Whereas these prodromal symptoms will be less in measles. There also you will find rash. Sorry, German measles. Okay, then is rubella. The other is rubeola. German measles, this will be less. Instead, you will find, post-auricular and posterior post-occipital lymph nodes. You will find lymph nodes there. Okay. And rubella, congenital rubella syndrome, So remember using this mnemonic, rubella, triad. Ru means you can't see rubies because, cataract. Bell, you can't hear. Sensory neural deafness. A is written as heart. Okay. So cardiac abnormality, usually PDA. Are you seeing it? Another triad, just like this is peck-shaped upper incisors. Mulberry molar. So which one? This is congenital syphilis. And in congenital syphilis, the triad is known as Hutchinson's triad, right? And how do you remember Hutchinson's triad? I've given you that mnemonic in my Insta. In all these, I have given mnemonics in Insta. If you're following, you might have following. Okay. Following doesn't mean that simply following. If you are listening to all that, you might have seen these 3 monkeys, right? So in Hutchinson's triad, how are these monkeys sitting? I can't see because of interstitial keratitis. Can't hear because of sensory neural deafness. And teeth, Hutchinson's teeth. Okay. Now coming to RCH. What is the time? I'm exceeding time. Is it okay if I take little more time? Okay, I'll definitely end up this session in another 10 minutes. Okay, please sit back for another 10 more minutes. This is MTP kit for oral abortifacient. As you can see in MTP kit, there's mifepristone, which is oral, and misoprostol, 800 microgram. And it is given for 9 weeks of, this is medical abortion. Okay, for 9 weeks of pregnancy. It is given only up to 9 weeks of pregnancy. That is the next MCQ. So if a patient is coming to you, give this orally, mifepristone orally, and after 1 day, you pervaginally induce her with 800 microgram of misoprostol. So that will induce sustained contraction and she will start bleeding little by little. And along with the bleeding, the fetal remnants also will be taken out. And then you have to make sure whether the fetal the whole of the fetal part has been removed or not. For that, you have to do a USG. Okay, and if you see that something is still left behind, you have to manually curate it out. Okay. Then Anemia Mukt Bharat. Very important. In Anemia Mukt Bharat, this is the logo. You can see 6 people standing together with their hands holding. This number 6 is very important because in Anemia Mukt Bharat, you have something known as 6 into 6 into 6 strategy. That is why this number 6 important. And you see 6 people. Now, what is this 666? You have 6 beneficiaries, 6 interventions, and 6 institutional mechanisms. 6 beneficiaries are what you see here. Okay. 2 are children. 6 to 5 years, 5 to 9 years. Then you have women, pregnant and lactating. Women in the reproductive age group, pregnant women, lactating women. And in the middle, you have 10 to 19, which is known as adolescent. 10 to 19, which is known as adolescent. Okay. And 6 interventions are, as you can see in this picture, I'm not going into those details. You read it later. And 6 institutional mechanism, nobody will ask you. Okay. And the iron folic acid that you give for each of this is again an MCQ. Just remember, guys, this is already arranged in the ascending order. So remember these numbers. 1, 2, 3, 4, 5, 6. Are you seeing? 1, 2 means for the first group, 6 months to 5 years, you are giving 100 microgram of folic acid and 20 milligram of elemental iron. For the next group, it is, I wrote 3, 4, but it is not actually 3, 4, but 4, 4. Are you seeing? That means 400 microgram of folic acid and 45 milligram of elemental iron. Then for the next, it is 5, 6. That means 500 microgram of folic acid and 60 milligram of elemental iron. Thereafter, the same you are giving for everyone. That is from 20 years onwards. Sorry, 10 years onwards, it is 60 milligram of elemental iron and 500 microgram of folic acid. And how long will you give it? That we already know. For pregnant and lactating women, see, pregnant and lactating, I have put in one single group. We know that you're giving 180 days antenatal and 180 days postnatal. For children, small children, that means 6 months to 5 years, it is given as syrup. So there you are giving it twice every week. And for all others, it is weekly once. Okay. So this is the one that is available. Can you see? 60 milligram of elemental iron and 500 microgram of folic acid. Because usually students ask me, madam, in that teacher taught me it is 100 milligram. You said 60 milligram. See, according to Anemia Mukt Bharat, see, I have taken the picture and I'm showing you. That is 60 milligram. And then we have in RCH, Pradhan Mantri Madritva Vandana Yojana, under which you are giving 5,000 rupee. Pradhan Mantri Madritva, you don't have to mug up. See, Madritva means maternity. Vandana means, as a respect. So for respecting Madritva, that means for respecting, pregnancy, you are giving 5,000 rupee. And that is given not as a lump sum amount, but as 3 installment, that too based on certain conditions. The first installment is given at early registration of pregnancy. She'll be getting the first 1,000 rupee. Second, she will get 180 days, provided after or during pregnancy, after 180 days, provided she has taken minimum 190 days checkup. She'll get the next 2,000 rupee. How much is left? 2,000. That she'll get after delivery, provided she has registered the birth of the baby as well as she has given the first cycle of immunization, then she'll get the next 2,000. And what is new? Now we have Pradhan Mantri Madritva Vandana Yojana 2.0, where rupees 6,000 is given for the second girl child. Okay, that is given as a whole amount. 6,000 is given for second girl child. Then we have Janani Shishu Suraksha Karyakram. Janani, as the name indicates, you don't have to mark up. That is why I always say as the name indicates. Janani, mother. Shishu, baby. Suraksha means protection. So this is for protecting the health of mother and baby. Here, you are giving all the services free for mother and baby, including, everything right from the diagnosis, drugs, food, delivery, everything is free. Even the transportation is free, and for the baby also up to 1 year, everything is free. Then you have Lakshya. In Lakshya, Q is always written like this. Now, what is Q? Q is quality of care. Quality of care in labor rooms. So this is to improve the quality of care in labor rooms. And we also have something known as Suman, which is Surakshit Madritva Ashwasan, where all the mother and child programs are kept under one roof. That is Suman. Okay. So these are for antenatal and all. Now the baby is born. Once baby is born, you have Navjat Shishu Suraksha Karyakram. As the name indicates, Navjat Shishu means just to born. Right. Suraksha, protected or health. So for the protection of just born babies, this program ensures that there will be a person who's trained in neonatal resuscitation at every delivery point. Wherever delivery is taking place, there should be a doctor who is trained in neonatal resuscitation. Okay. Neonatal resuscitation. That is Navjat Shishu. And then you also have Rashtriya Bal Swasthya Karyakram, RBSK. As the name indicates, Rashtriya, of course, national. Bal, children, not this Bal. Okay, don't think about that. Children, 0 to 18 years. Swasthya, health. Okay. So it's a Karyakram for children 0 to 18. So here what you do is, okay, 0 to 18 years. Here what you do is, all children between 0 to 18 years will be screened for 4 Ds which are prevalent in children. Which are those 4 Ds? Not the pellagra wala 4D. Defects at birth, like, cleft palate, Down syndrome, neural tube defect, diseases in children like caries, seizures, deficiency conditions like vitamin D deficiency, then developmental delays and disabilities like, learning impairment, visual impairment, all these will be screened. And I'm showing you all the diseases which are coming under. There are 30 conditions that you're screening, and I'm not going into the details. I'm showing you all the 30 conditions. So you can always go back and refer to this. Okay. And what is this? PMJ, Pradhan Mantri Jan Arogya Yojana. This is our national health insurance scheme. Pradhan Mantri Jan Arogya Yojana, coming under Ayushman Bharat, under which how much amount are we giving for the insured free, if there is a medical emergency, if there is some medical help needed, then government is giving amount of rupee, how much? What you see here is the, yes, correct. Yeah, Prashanta, you're right. So this is the logo. You see 5 leaves, right? 1, 2, 3, 4, 5. So each leaf you can relate to 1 lakh. So it is 5 lakh rupee per family. And it always works using e-card, just like you have, the ATM card. This card will have the beneficiary's name, all the details. There will be a chip enabled. So using this card, just like your ATM card, you can make the transactions. Okay, there are a lot of questions. I'm not going into those questions because we don't have time for all those questions. And let me quickly go through the next one. Mother and child. Okay, MCH, very, very important. We'll go from antenatal, natal, postnatal, and the MCQs. Number of antenatal checkups. According to Indian guideline, it is 4, and according to WHO guideline, it is 8. Don't you know that? Minimum number of antenatal checkups. And when all these should be given, You can refer back. Okay. So 8, according to WHO, both are MCQs. Next, when she's coming for antenatal checkup, you have to advise her about mainly 3 things. One is about the diet, immunization, and iron folic acid. Iron folic acid we have already seen, so we don't have to worry about that. When it comes to diet, we know that during pregnancy and lactation, there is an increased requirement for energy as well as protein. During pregnancy, she's asked to take extra 350 kilocalorie and 22 gram protein. Okay. And how to remember this 350? These 350 is nothing but one extra meal. Because what we normally take during meal for your lunch is 350. So you just ask her to take one extra meal. So remember 350 kilocalorie. And this 22 gram, I hope you know that, is again divided for second trimester, it is 9.5. And for third trimester, it is 22 gram, just in case they ask. And lactation is again divided into first 6 months and then rest of the 6 months. What is the first 6 months? Exclusive breastfeeding, right? So there she's feeding baby all the time. That means she's working all the time. So she requires more energy, almost see double the calorie of what she's asked to take during pregnancy. So it is 600 milligram and 17 gram of protein. Protein requirements comes down because baby is out. Okay. And the rest of the 6 months, it is 520 and 13 gram protein. Now, how to remember this? Guys, just have a look at this. Please, 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 please look at this. Up to 6 months, 600. Up to 12 months, 520. Are you able to see? So here I said, remember, one extra meal, which is 350. Here, 6 and 6, 2 and 2. Okay, if I had time, I would have explained it nicely, but you're understanding, right? Now coming to vaccination. Which is a vaccine? TD vaccine. Oh, let me take some other color. Okay. Vaccinus TD vaccine. It's not TT anymore, but TD. Capital T, small d. Small d is adult diphtheria content. How many doses? You're giving 2 doses. Okay, 2 doses. When will you give the first dose? At the earliest. Second dose? First at the earliest. Second dose? 4 weeks after that. So that will give protection for 3 years. That means if she is getting pregnant, once again, in the next 3 years, she require only 1 booster dose. And when will you give that booster dose? That is the next MCQ. Booster dose, ideally 4 weeks before the expected date of confinement. Okay. And thank God, this one we have already seen. And folic acid. And when it comes to intranatal, the most important thing is you have to observe clean practices in delivery to prevent neonatal tetanus. And there are 5 cleans for eliminating neonatal tetanus. Okay. See, guys, you believe it or not, as long as the child is inside the womb of the mother, the child is safe. But the moment it decides to come out, we doctors and hospitals are waiting outside to introduce neonatal tetanus to the baby, right? That means the baby is getting neonatal tetanus through us, right? That means there are 5 levels in which you are likely to introduce neonatal tetanus to the baby. So preventing those 5 levels, you have 5 cleans. Okay. So the first clean starts in the second stage when she's coming. She's full, already cervix dilated. You are offering her a delivery surface. If that surface is not clean, then the Clostridium tetani can ascend and give disease. So the first is clean delivery surface. Okay. Next, the baby is about to come out and we doctors are waiting outside with unclean hands. So the second is clean your hands. Third, we have 3 more cleans and all these 3 cleans are with the cleanliness of code. Next is when you're cutting, use something sterile. After that, when you tie, you use a clean tie, but it's not a problem anymore because we have, even in government hospitals, we have sterile clips available. Then after that, keep the cord stump clean. That means don't apply anything. See, in some places, they have a habit of applying cow dung, ash, mud, all these over the stump. Don't do anything like that. Now, that is again, this 5 cleans. is replaced with 7 cleans. We have 2 more extra cleans. Which are they? Clean water and clean towel. Okay. If we are, it is especially asking doctors to wash your hands with clean water and use clean towel. Don't just dry it on your apron. Okay. So these are the 5 and 7 cleans. Now coming to the next, breastfeeding. Very, very important. The first form breast milk is known as colostrum, right? I'm going to show you a picture which among this is colostrum. You can even get it as an image-based question. This is colostrum, right? This is colostrum. This is colostrum. Whereas this is mature breast milk. Now, let's see the MCQs from colostrum. You know, guys, colostrum, why is it yellow in color? Yellow to orangish in color? Because it has high concentration of, or it is thickly packed with. If you're saying fat, you're wrong. Totally wrong, because that is something which will get you wrong. Okay. So remember PAC. It is thickly packed with. I'm giving you the MCQs. Thickly packed with, that is the mnemonic. Protein, with P you have protein, with A you have antibody, and with C you have carbohydrate. That means it is high in protein, carbohydrate, and antibody. Whereas colostrum is less in 2 things: fat and sugar. It has low concentration of fat and sugar. You always tend to think that it is yellow because it has high fat, but that is wrong. Am I clear? It has high concentration of protein, carbohydrate, antibody, whereas it is less in fat and sugar. Okay. Now coming to exclusive breastfeeding, you know that when to start? At the earliest you have to start. Exclusive breastfeeding is for 6 months, right? And WHO say you have to continue it for 2 years. I'm only writing the MCQs. Now coming to MCH indicators, very, very important. Very important means very important. Okay. Guys, are you still there? I know it's very, very late. Are you there? Okay. I'll talk about MCH indicators and later we will wind up. See, MCH indicators means mother and child indicators. When it comes to mother indicators, the most important one is MMR, which is, sorry, where is it? Yeah, MMR. Full form is maternal mortality ratio and not rate. Guys, it's not rate, it is ratio. Rate is something else, I'll tell you what it is. Ratio means numerator different, denominator different. Numerator, you have number of maternal deaths divided by live births in the denominator into 1 lakh. See, it is not 1,000 but 1 lakh. This means that when 1 lakh children are born alive into a population, how many maternal deaths are happening? Am I clear? Next MCQ is, what is maternal death? There is a definition for maternal death. A woman dying while she is pregnant or at the time of delivery or after delivery. For how long? For 42 days or 6 weeks, but not from accidental or incidental cause. That means if she is dying in an accident, you cannot call it as maternal death. If she's committing suicide, you cannot call it as maternal death. I hope it is clear, because you will see a lot of questions from this. Okay. A lady died in electrocution. Can you call it as a maternal death? No, it cannot be called as a maternal death. In drowning, it cannot be called as a maternal death. Okay. So this is maternal mortality ratio. Whereas in maternal mortality rate, numerator is the same, total number of live birth, maternal deaths, whereas denominator is total number of women in the reproductive age group. So this is maternal mortality rate and the other is maternal mortality ratio. So MMR is maternal mortality ratio and not rate. Are you with me? Now coming to the child indicators. These are the child indicators. Okay. And the numerator and denominator are very, very important MCQs. I'll tell you. I'm not going to read this. You know this, right? First, I'll tell you about the denominator. In all these, except the one which has got number. So which one has got number? That means except 1 to 4 year mortality rate. I'm going to tell you the denominator first. The denominator is total number of live births. So that brings you the next question. What do you have in the denominator of 1 to 4-year mortality rate? It is children in the age group 1 to 4 years. Children in the age group 1 to 4 years. Okay. So number of children in 1 to 4 years is what you have in the denominator here. Whereas in all others, the denominator is total number of live births. Okay. Before that, let me tell you the type of questions that you can expect. These you have to remember. First, remember as coming under childhood indicators. Then there is a formula. That is what I'm trying to tell you. Every formula has got a numerator and denominator. Numerator and denominator, each of these are MCQs. Third, problem-based questions you will get from MCH indicator. So that also you have to learn. Okay. So we are done with denominator part. Moving on to the numerator. For that, look at this picture. That will tell you the numerator. Infant mortality. What do you mean infancy? As you can see, 0 to 1 year is infancy, right? 0 to 1 year is again divided to first 1 month and rest of the months. First 1 month, it's not 30 days or 31 days, but 28 days. That means 0 to 28 days is neonate. And 28 to, that means 29 to 1 year is post-neonate. You know, neonate is again divided to, that is first 1 month is again divided to first 1 week. Are you seeing? First 1 week and rest of the weeks. First 1 week is early neonate and 8 days to 28 days is late neonate. Okay. Next, what is stillbirth? Stillbirth, as you know, is a child dying before birth, but after attaining viability. When does a child attain viability? At 28 weeks of gestation. That means stillbirth is a child dying after 28 weeks of gestation, but before birth. Are you seeing it? I'm showing you. Okay. Now, what about peri? In and around. Okay. So this includes in and around the time of birth. This includes few days before birth and few days after birth. Few days before birth is nothing but the time that you consider as stillbirth, and few days after birth is nothing but the time that you consider as early neonatal period. Okay, so that denotes, so that covers the numerator as well. So peri means stillbirth plus early neonate. Now I'll show you the type of questions that you can expect. See, for a pregnant woman, what is the ideal number of antenatal visits? Like this. And I'll come to this. Guys, are you there? Are you still there? India Newborn Action Plan. Now, what is it? This is to reduce the neonatal mortality rate and stillbirth rate to single digit by 2030. Okay. Now, coming to childhood diseases. Now, the child is growing. Okay. As the child grows, naturally, it will come across many diseases. And for preventing childhood diseases, we have something known as IMCI, Integrated Management of Childhood Illness. I'm not going into the details. Please do understand that. Here, you are integrating management protocols of various childhood deaths. Okay, under 5 deaths. And the diseases that, first, next question. Before that, let me ask you, can I continue for little more time? Little more. Let me just, I want to know whether you are still there. Okay. Okay. Let me complete this also. So in integrated management of neonatal and integrated management, as the name indicates, you are integrating the management for protocols of various childhood illness. Okay. And here what you do is, first you have enlisted, in India, what we have done is, we found the major under 5 killers, which are diarrhea, ARI, malaria, measles, malnutrition. Which are the diseases coming under IMCI is a MCQ. Then we listed their signs and symptoms, and then we classified them into 3 different colors. And the colors are green, yellow, and pink. If as per the signs and symptoms, if the child is coming under green, home management, yellow, OP treatment, and pink means sober color of red. That means they require referral. Okay. And the Indian version is known as IMNCI. Okay. And the next problem as a child grow is malnutrition. And we have two types of malnutrition, acute and chronic. Acute means if the child has not taken food for few days, or if you don't take food for few days, what will happen? You will lose your weight, whereas your height will be all right. And you look something like this, right? So this is low weight for height. Are you understand? Your height will be all right, whereas your weight, you will start losing your weight. So this is known as acute malnutrition, also known as nutritional wasting or emaciation. Whereas chronic means if you had not taken food for a long time, naturally, that means since childhood, that will affect your height as well. So low height for ages, stunting or dwarfing, which is seen in chronic malnutrition. I hope it is clear. So you have acute as well as chronic. Okay. Then you have severe acute malnutrition, which is there are three criteria: very low weight for height, mid-arm circumference less than 11.5 centimeter, and presence of nutritional edema. So such children should be sent to nutritional rehabilitation center. You can't do anything from your hospital. Okay. And this is about growth chart. In growth chart, you know, we have three colors: green, yellow, and red. Green means the child is having good nutrition. Yellow means moderate malnutrition. Red means severe malnutrition. Green, as per the standard deviation, I'm not going into the details, it is within -2 standard deviation. Okay. Moderate means less than -2 standard deviation. Severe means less than -3 standard deviation. Okay, that means the child is very much away from normalcy. You know, standard deviation, within 2 standard deviation is normal, right? Within 2 standard deviation, we have learned that it is normal. So this is away from normalcy, very much away from normalcy. And if the child, suppose you are getting the question like a child is found to have fallen in yellow, what advice will you give as a doctor? If green, ask them to continue the same food because it's good, right? Green means good to go. Child is normal. Yellow, you have to give nutritional advice. Tell them what all should be taken. Red means severe. And we have seen that severe malnutrition you cannot manage from PHC. You have to refer them to higher center. Okay. Now let's see the type of questions you get. This we have already seen. Wasting is weight for height. This we have already seen. This actually comes from the nutrition. Exclusive breastfeeding. All these are from very last exam. 6 months. Then anemia Mukt Bharat. Iron folic acid is given during second trimester for the next 6 months, right? This type of questions you will get. Okay. 50 stillbirth, 50 neonatal deaths, then live births, this much, 8 to 28 days, 150, calculate neonatal mortality rate. Don't you know how to calculate neonatal mortality rate? So these type of questions you will get. Due to lack of time, I'm not going to the details. See, this much is there in the question and you'll get it as 50. Okay, I just wanted to show you the type of questions that we will get. Anyway, you can go back and refer all the time. Folic acid in deficiency in pregnancy can cause neurotube defect. You know that. And this is the type of question I said about MMR. Okay, maternal deaths are given. Ectopic pregnancy, puerperal sepsis, abortion, PPH, all those are coming. See, electrocution, that will not come. So remove that. And live births they have already given. Okay. Which the following is not coming under MMR. 30 weeks. RTA will not come. Okay. Okay, guys. Another very, very important is, let me just show you something very important. Where has it gone? Demographic cycle. Very, very important. Okay. So demographic cycle are of 5 stages: high stationary, early expanding, late expanding, low stationary, and declining. Okay. Each of this stage is explained based on the shape of the demographic gap. Okay. And demographic gap means it is a gap. See, you have a x-axis, y-axis. Okay. Along the y-axis, we are plotting birth rate and death rate. This gap is demographic gap. Okay. So based on the shape of demographic gap, we are having 5 stages in demographic cycle. What is, see, first stage was high stationary. So these names you have to remember. And what is actually happening, that also you should remember. Okay. High stationary means it was in the pre-industrial era. In pre-industrial era, birth rate was high, death rate was high, but the number of births and deaths were almost equal in number. So what is happening to the gap? It is stationary, but at a higher rate. This is high stationary. Then what is stage two? Stage two was in early industrial era. In early industrial era, people, new hospitals opened up, new medicines were discovered. So people started accessing health service, as a result of which death rate started coming down with birth rate going as such. So this is early expanding. Can you see? Now what is late expanding? Stage three was in industrial era. Industrial era, family planning was introduced. So people started accessing, contraceptives. So birth rate also started coming down with further dip in death rate. That is late expanding. Then what is low stationary? This was in post-industrial era. Birth rate less, death rate less. The number of births and deaths were almost equal in number. This is low stationary, but at a lower rate. Now, what is stage 5? See, in stage 5, what is happening is you cannot bring any further decrease in number of deaths. Do you agree with me? You can never take it up till 0. Whereas this is not the case with number of births. You can take any decrease in number of births and you can take it up till 0. Right? This is what is happening in declining phase. Death rate going as such, but birth rate is going below death rate. That means more people are dying than being born. So naturally, it will decline. I hope it is clear. So these are the 5 stages in demographic cycle. Okay, guys. So thank you very much for sitting along with me. And we have few more important topics, but it's not possible to, finish a vast subject. Already it's been more than 4 hours. So I hope it was useful. Just give me a feedback. Was it useful, guys? If you have any doubt, you can contact me through WhatsApp or through my Instagram ID. Somehow you can, I'm just trying to give you my number once again. I can't find it. Okay. So let me just check. It's there. Okay. So this is my WhatsApp number. This is my Instagram ID. If you have any doubt, yes, of course, I couldn't complete every topic. Come on, guys. It's a huge subject. You can't expect me to cover the whole subject in just 4 hours. It needs around 40 days to complete. But definitely, I've gone through all the many of the important MCQs and all the tough subjects we have taken. And there is a FMGE WhatsApp group where we are discussing PSM on a daily basis. And if you're interested, you can get in touch with me through my WhatsApp. I'll send you the link for that group. And I hope it was useful. Was it useful, guys? I know I took for around 4 hours. Was it useful? See, I want to tell you something. You have to work hard because success is no accident. We know that, right? And even though it is late, always think positively. You will never lose because positivity always wins, right? And at this point, you may feel that it is impossible, but once you start doing, things will start getting possible. And I always love this quote by Paulo Coelho, which inspired me a lot. If you really want something so badly, then the whole world will help you to get it. Okay, so stay positive, guys. Good night and all the best. Was it useful? Was it useful? Just give me a feedback. Most welcome, Asif. Of course, you can expect, of course, many questions will be from this that I can that I can vouch for. Thank you, Kitsi. Thank you, guys. I should thank you for sitting for so long, uh, for around 4 hours. You all were there. I've already done numericals. Most important numericals will be from this MMR, IMR, those things. Thank you, guys. Thank you very much for your patient listening. Love you all. All the best. You're, you think I have all the energy now? No, it's gone. It's gone. But you are also energetic. Yeah. Bye. Good night. Shall we close it? Bye, guys. Good night. Love you all.